2022 ഭാഗമായുള്ള സാറ്റലൈറ്റ് സെമിനാർ സെഷനിൽ എത്തിച്ചേർന്ന എല്ലാ ആയുർവേദ സ്നേഹികൾക്കും PNNM കുടുംബത്തിലേക്ക് സുസ്വാഗതം.
വേൾഡ് ആയുർവേദ കോൺഗ്രസ് എന്ന ആയുർവേദത്തിന്റെ സമഗ്ര വളർച്ചയ്ക്കായി 2002 രൂപം കൊണ്ട ആ മഹാവേദിക്ക് ഈ വർഷം സാക്ഷ്യം വഹിക്കുന്നത് ഗോവയാണ്. 2002 ആദ്യത്തെ വേൾഡ് ആയുർവേദ കോൺഗ്രസിന് വേദിയായത് നമ്മുടെ കൊച്ചിയായിരുന്നു. 2022 ഡിസംബർ മാസം 8 മുതൽ 11 വരെ ഗോവ പഞ്ചിം കലാ അക്കാദമിയിലാണ് 9ാമത് വേൾഡ് ആയുർവേദ കോൺഗ്രസ് ആൻഡ് ആരോഗ്യ എക്സ്പോ സംഘടിപ്പിക്കപ്പെടുന്നത്.
PNNM ആയുർവേദ മെഡിക്കൽ കോളേജിനെ സംബന്ധിച്ചിടത്തോളം 9th വേൾഡ് ആയുർവേദ കോൺഗ്രസിന്റെ മുഖ്യ സംഘാടകരിൽ ഒരാളായി നമ്മുടെ പ്രിയപ്പെട്ട ഡയറക്ടർ ശ്രീമതി സന്ധ്യ മണ്ണത്ത് ഉണ്ട് എന്നത് തികച്ചും അഭിമാനപൂരിതമായ ഒരു വസ്തുത. ഈ സാറ്റലൈറ്റ് സെമിനാറിന് PNNM ആയുർവേദ മെഡിക്കൽ കോളേജ് വേദിയായതും അഭിമാനപൂർവ്വം ഞങ്ങൾ സമർപ്പിക്കുന്നു.
സമൂഹത്തെ കാർന്നു തിന്നുന്ന ഒരു മഹാവ്യാധിയാണ് ക്യാൻസർ. സ്കോപ്പ് ഓഫ് ആയുർവേദ ഇൻ വാരിയസ് സ്റ്റേജസ് ഓഫ് ക്യാൻസർ മാനേജ്മെന്റ് എന്ന കാലിക പ്രസക്തമായ വിഷയത്തിൽ വിദഗ്ധ അഭിപ്രായങ്ങൾ പങ്കുവെക്കുന്നതിനും നമ്മെ പ്രബോധിപ്പിക്കുന്നതിനുമായി PNNM കോളേജ് പ്രിൻസിപ്പാളും ശല്യതന്ത്ര വിഭാഗ മേധാവിയുമായ Dr.T.Sreekumar സാറും കോട്ടക്കൽ ആര്യ വൈദ്യശാല ചാരിറ്റബിൾ ഹോസ്പിറ്റൽ ചീഫ് മെഡിക്കൽ ഓഫീസർ Dr.K.M.Madhu Varier സാറും നമ്മോടൊപ്പമുണ്ട്. സാറ്റലൈറ്റ് സെമിനാറിന്റെ ഭാഗമാകാൻ ഇവിടെ എത്തിച്ചേർന്ന ഇവർക്കും ഒരിക്കൽ കൂടെ നമസ്കാരം. സെഷൻ ആരംഭിക്കാം. ആദ്യമായി ഈശ്വര പ്രാർത്ഥന.
शम्भो मनांसि जानता देवाभागं यथा पूर्वे सञ्जानाना उपासते सङ्कजत्वं संवदत्वं शम्भो मनांसि जानता समानिव आकुति समान हृदयानिव समानमस्तु मनो यथा वः सुसहसति सङ्कचत्वं संवदत्वं शम्भो मनांसि जानता शम्भो मनांसि जानता शम्भो मनांसि जानता.
ചടങ്ങിനെ സ്വാഗതം ആശംസിക്കുന്നതിനായി PNNM ആയുർവേദ കോളേജിന്റെ ഊർജ്ജസ്വലനായ വൈസ് പ്രിൻസിപ്പൽ Dr. K.M.Madhu സാറിനെ സാദരം ക്ഷണിച്ചു കൊള്ളുന്നു.
ബഹുമാനപ്പെട്ട സെക്രട്ടറി മുരളി സർ, കോളേജ് ഡയറക്ടർ സന്ധ്യ മണ്ണത്ത്, പ്രിൻസിപ്പൽ ശ്രീകുമാർ സർ, മറ്റ് അധ്യാപക അനാധ്യാപക വിദ്യാർത്ഥി സുഹൃത്തുക്കളെ എല്ലാവർക്കും എൻ്റെ വിനീത നമസ്കാരം. PNNM ആയുർവേദ മെഡിക്കൽ കോളേജിനെ സംബന്ധിച്ച് ഇന്ന് ഏറ്റവും സന്തോഷവും അഭിമാനവുമുള്ള ഒരു ദിവസമാണ്. നമുക്കറിയാം വേൾഡ് ആയുർവേദ കോൺഗ്രസ് എത്രത്തോളം പ്രസക്തിയുള്ള ഒരു കാലഘട്ടമാണെന്നുള്ളത്. കാരണം ഈ വർഷം വേൾഡ് ഹെൽത്ത് ഓർഗനൈസേഷന്റെ കൂടി ആക്റ്റീവ് പാർട്ടിസിപ്പേഷൻ ഉള്ള ഒരു വേൾഡ് ആയുർവേദ കോൺഗ്രസ് ആണ്, 9th വേൾഡ് ആയുർവേദ കോൺഗ്രസ് ആണ് ഗോവയിൽ സംഘടിപ്പിച്ചിരിക്കുന്നത്. അതിന്റെ ഒരു സാറ്റലൈറ്റ് സെമിനാർ നമ്മുടെ കോളേജിൽ, നമ്മുടെ ഈ സ്ഥാപനത്തിൽ നടത്തുക എന്നുള്ളത് വളരെ സന്തോഷവും അഭിമാനവും ഉള്ള ഒരു നിമിഷം. അതിൽ നമ്മളെല്ലാവരും വളരെ സന്തോഷരാണ്. അതിനായിട്ട് എത്തിച്ചേർന്നിരിക്കുന്ന നിങ്ങൾ ഓരോരുത്തരെയും ഇതിലേക്ക് സ്വാഗതം ചെയ്യുക എന്നുള്ളതാണ് എൻ്റെ കർത്തവ്യം. നമ്മളുടെ ഈ ഒരു ഇന്നത്തെ സെമിനാർ ഉദ്ഘാടനം ചെയ്ത് നമ്മളോടുകൂടി ആവുന്നത് നമ്മുടെ ബഹുമാനപ്പെട്ട സെക്രട്ടറി ശ്രീ മുരളി സാറാണ്. നമുക്കറിയാം നമ്മുടെ കോളേജിന്റെ നെടുംതൂണാണ് ശ്രീ മുരളി സാർ. മുരളി സാറിനെ സ്നേഹപൂർവ്വം ഈ ഒരു ചടങ്ങിലേക്ക് സ്വാഗതം ചെയ്യുന്നു. അതോടൊപ്പം ഇന്നത്തെ ഈ വേൾഡ് ആയുർവേദ കോൺഗ്രസിനെ കുറിച്ച് കഴിഞ്ഞ കാലങ്ങളിൽ നടന്നിട്ടുള്ള വേൾഡ് ആയുർവേദ കോൺഗ്രസും ഇനി നടക്കാൻ പോകുന്നതുമായിട്ടുള്ള ഗോവയിലെ കോൺഗ്രസിനെ കുറിച്ചുള്ള ഒരു ഇൻട്രൊഡക്ഷൻ നമുക്ക് തരുന്നത് നമ്മുടെ ബഹുമാനപ്പെട്ട ഡയറക്ടർ ശ്രീ സന്ധ്യ മണ്ണത്താണ്. മേഡത്തിനെയും ഹൃദയപൂർവ്വം ഈ ഒരു ചടങ്ങിലേക്ക് സ്വാഗതം ചെയ്യുന്നു. നമുക്ക് ഇന്ന് പ്രസന്റേഷൻസ് ചെയ്യുന്നത് നമ്മുടെ ക്യാൻസറിനെ കുറിച്ചുള്ള ആയുർവേദം ക്യാൻസറിനുള്ള ഒരു ടോപ്പിക്കിൽ നമുക്കൊരു 2 ക്ലാസ് നടത്തുന്നത്. ഒന്ന് നമ്മുടെ ബഹുമാനപ്പെട്ട ശ്രീകുമാർ സാർ പ്രിൻസിപ്പൽ ആണ്. സാറിനെ ഹൃദയപൂർവ്വം ഈ ഒരു ചടങ്ങിലേക്ക് സ്വാഗതം ചെയ്യുന്നു. അതോടൊപ്പം രണ്ടാമത്തെ പ്രസന്റേഷൻ സാർ ഇവിടെ എത്തിയിട്ടില്ല. മധു വാര്യർ സാറാണ്, കോട്ടക്കലിലെ സീനിയർ ആയിട്ടുള്ള ഫിസിഷ്യൻ ആണ്. വളരെ ക്യാൻസറിനെ കുറിച്ച് ധാരാളം അനുഭവ സമ്പത്തുള്ള സാറിന് നമുക്ക് ക്ലാസ്സസ് തരിക എന്നുള്ളത് നമുക്ക് വളരെ സന്തോഷമുള്ള ഒരു കാര്യമാണ്. സാറിന്റെ അഭാവത്തിലും സാറിനെ ഹൃദയപൂർവ്വം ഈ ഒരു ചടങ്ങിലേക്ക് സ്വാഗതം ചെയ്യുന്നു. അതോടൊപ്പം നമ്മളുടെ ഈ വേൾഡ് ആയുർവേദ കോൺഗ്രസിന്റെ ഒരു സ്നീക് പിക്, അതായത് അതിന്റെ നടത്തിപ്പിനെ കുറിച്ചും അതിന്റെ മറ്റ് ഷെഡ്യൂളുകളെ കുറിച്ചും വിവരിക്കുന്നത് കൗമാരഭൃത്യം ഡിപ്പാർട്ട്മെന്റിലെ അസിസ്റ്റന്റ് പ്രൊഫസർ ഡോക്ടർ മീര നായരാണ്. ഡോക്ടറെ ഹൃദയപൂർവ്വം ഈ ഒരു ചടങ്ങിലേക്ക് സ്വാഗതം ചെയ്യുന്നു. നമ്മുടെ ഈ ചടങ്ങിന് നന്ദി ആശംസിക്കുന്നത് നമ്മുടെ ഹോസ്പിറ്റൽ ഡയറക്ടർ നിരുപമ മേഡമാണ്. മേഡത്തിനെയും ഹൃദയപൂർവ്വം ഈ ഒരു ചടങ്ങിലേക്ക് സ്വാഗതം ചെയ്യുന്നു. അതോടൊപ്പം നമുക്കറിയാം ഇന്നത്തെ ഈ ഒരു ചടങ്ങിലെ ഏറ്റവും മുഖ്യ ഇതെന്ന് പറഞ്ഞാൽ നമ്മുടെ ശ്രോതാക്കളാണ്. നിങ്ങൾ ഓരോരുത്തരെ, അതായത് മറ്റു കോളേജുകളിൽ നിന്നും ഡെലിഗേറ്റ്സ് ഉണ്ട്. അതോടൊപ്പം നമ്മുടെ കോളേജിലെ PG സ്റ്റുഡൻസ്, ഹൗസ് സർജൻസ്, വിദ്യാർത്ഥികൾ, സീനിയർ വിദ്യാർത്ഥികൾ എല്ലാവരും ഉണ്ട്. എല്ലാവരെയും സ്നേഹപൂർവ്വം ഈ ഒരു ചടങ്ങിലേക്ക് സ്വാഗതം ചെയ്യുന്നു. നമുക്കറിയാം നമ്മളുടെ ഈ ഒരു പ്രോഗ്രാമിന് നമ്മൾ കുറച്ച് ദിവസങ്ങളായിട്ട് ഹാർഡ് വർക്ക് ചെയ്യുന്ന ധാരാളം ടീച്ചേഴ്സും നോൺ ടീച്ചിങ് സ്റ്റാഫും ഉണ്ട്. എല്ലാ അനധ്യാപക സുഹൃത്തുക്കളെയും സ്നേഹപൂർവ്വം ഈ ഒരു ചടങ്ങിലേക്ക് സ്വാഗതം ചെയ്യുന്നു. ഒരിക്കൽ കൂടി എല്ലാവർക്കും നമ്മളുടെ ഇന്നത്തെ സെമിനാറിലേക്ക് സ്വാഗതം ആശംസിച്ചുകൊണ്ട് നിർത്തുന്നു. നന്ദി, നമസ്കാരം.
Thank you, sir. World Ayurveda Congress 2022 റീജിയണൽ കോർഡിനേറ്ററും കോളേജ് ഡയറക്ടറുമായ മിസസ് സന്ധ്യ മന്നത്ത് ഇന്നത്തെ സാറ്റലൈറ്റ് സെമിനാറിന് ചുക്കാൻ പിടിച്ചുകൊണ്ട് നമ്മോടൊപ്പമുണ്ട്. വേൾഡ് ആയുർവേദ കോൺഗ്രസിനെയും ഇന്റർനാഷണൽ ആരോഗ്യ എക്സ്പോയെയും കുറിച്ച് ഒരു ആമുഖം നമ്മോട് പങ്കുവെക്കുന്നതിനായി സാദരം സന്ധ്യ മേഡത്തെ ക്ഷണിച്ചുകൊള്ളുന്നു.
എവർക്കും പ്രണാമം. ഇന്ന് ഈ വേദി സാഗൂതം വീക്ഷിക്കാൻ കാത്തിരിക്കുന്നത് സത്യത്തില് നമ്മുടെ ശ്രീകുമാർ സാറിൻ്റെയും മധു സാറിൻ്റെയും ആയുർവേദ ഓങ്കോളജി എന്നുള്ള സബ്ജക്റ്റിനെ കുറിച്ച് കേൾക്കാനും പഠിക്കാനും അറിയാനുമാണ് എന്നുള്ള ബോധ്യം എനിക്കുണ്ട്. എന്നാലും കേരളത്തിൽ നിന്ന് ട്രിവാൻഡ്രം ആയുർവേദ കോളേജും നമ്മുടെ PNNM ആയുർവേദ കോളേജുമാണ് വേൾഡ് ആയുർവേദ കോൺഗ്രസ് എന്ന ആയുഷ് ഡിപ്പാർട്ട്മെന്റിന് കീഴിൽ വരുന്ന ഈ പരിപാടി ഹോസ്റ്റ് ചെയ്യാൻ ഭാഗ്യം ലഭിച്ച 2 കലാലയങ്ങൾ എന്ന സന്തോഷം ഈ വേദിയിൽ എല്ലാവരുമായി പങ്കുവെക്കുകയാണ്. PNNM കുടുംബത്തിന് ഇങ്ങനെയൊരു ഓണർ അല്ലെങ്കിൽ ഇങ്ങനെയൊരു അഭിമാന മുഹൂർത്തം തന്ന വേൾഡ് ആയുർവേദ കോൺഗ്രസിന്റെ അധികാരികളോടും നമ്മൾ എന്തെങ്കിലും ഏൽപ്പിച്ചു കഴിഞ്ഞാൽ ഗ്രൂപ്പായി പണിയെടുക്കും എന്ന് അറിഞ്ഞുകൊണ്ട് തന്നെ ആവണല്ലേ നമുക്കത് അസൈൻ ചെയ്തത്. അതുകൊണ്ട് തന്നെ കൂടെ ഒപ്പം ശക്തിയായി കഴിവ് തെളിയിച്ചു നിൽക്കുന്ന എല്ലാ എൻ്റെ അധ്യാപക സുഹൃത്തുക്കൾക്കും PNNM കുടുംബത്തിലെ ഓരോ അംഗങ്ങൾക്കും ആദ്യമേ കൈതവമായ നന്ദി അറിയിക്കുന്നു. ഇത് 9ാമത് വേൾഡ് ആയുർവേദ കോൺഗ്രസ് ആണ് ഡിസംബറിൽ ഗോവയിൽ വെച്ച് പഞ്ചിം എന്ന സ്ഥലത്ത് നടക്കാൻ പോകുന്നത്. കലാ അക്കാഡമി എന്ന ഏക്കറോളം വരുന്ന സ്ഥലത്താണ് ഇത് സംഘടിപ്പിക്കുന്നത്. 2002 ആദ്യമായി വേൾഡ് ആയുർവേദ കോൺഗ്രസ് രൂപം കൊണ്ടത്. അതിന് നസ്യ, വിജ്ഞാൻ ഭാരതി തുടങ്ങിയ ആയുഷ് ഗവൺമെന്റിന്റെ കീഴിലുള്ള ഒരുപാട് NGOs രൂപം കൊടുത്ത ഒരു സംഘടനയാണ് വേൾഡ് ആയുർവേദ കോൺഗ്രസ്. 2008 മുതൽ നമ്മുടെ കോളേജ് 2007 നീളാതീരത്ത് സ്ഥാപിതമായത്. ഏകദേശം ആ സമയം മുതൽ തന്നെ എങ്ങനെയൊക്കെയോ നമ്മൾ അതിൽ പിടിച്ചു കയറി ഈ 2022 ആ സ്ഥാനം നമ്മൾ തുടർന്നു വരികയാണ്. ഭോപ്പാൽ, അഹമ്മദാബാദ്, ഡൽഹി, ട്രിവാൻഡ്രം തുടങ്ങിയ എല്ലാ സ്ഥലങ്ങളും നമ്മൾ നമ്മുടെ പേര് അവിടെ തെളിയിച്ചിരുന്നു, നമ്മുടെ മുഖമുദ്ര അവിടെ ചാലിച്ചിരുന്നു, PNNM എന്ന പേര്. ഈ വർഷവും ഭംഗിയായി തന്നെ അത് നിർവഹിക്കാൻ എല്ലാവരുടെയും സഹായ സഹകരണങ്ങൾ നമ്മൾ ഈ അവസരത്തെ ഞാൻ റിക്വസ്റ്റ് ചെയ്യാണ്. എസ്പെഷ്യലി നമ്മുടെ PGs, ഹൗസ് സർജൻസ്, ഫാക്കൽറ്റീസ് കുറച്ചുപേര് പോകുന്നുണ്ട്. എല്ലാവരെയും വേൾഡ് ആയുർവേദ കോൺഗ്രസ് എന്ന ആ മഹാ പൂരം എന്നൊക്കെ പറയില്ലേ, നമ്മള് ഒരു പൂരം നടത്തുന്നത് എന്തിനാന്ന് ചോദിക്കുമ്പോൾ പണ്ടത്തെ ആൾക്കാർ പറയും ആ അമ്പലത്തിലെ ദൈവത്തിന് അല്ലെങ്കിൽ ദേവിക്ക് കൂടുതൽ ഓജസ്സും തേജസ്സും വരുത്താനാണ് പൂരം, അല്ലാതെ കുറെ പേരെ വിളിച്ചു വരുത്തി ഒരു ചടങ്ങ് നടത്താനല്ല എന്ന് പറയും. അതുപോലെ ആയുർവേദത്തിന്റെ ഓജസ്സും തേജസ്സും വളർത്താൻ വേണ്ടിയിട്ടാണ് വേൾഡ് ആയുർവേദ കോൺഗ്രസ് അല്ലെങ്കിൽ ഗ്ലോബൽ ആയുർവേദ തുടങ്ങിയ ചെറുപൂരങ്ങൾ ആയുർവേദ ഫ്രട്ടേണിറ്റി നടത്തുന്നത്. അത് എല്ലാ ആയുർവേദ മെമ്പേഴ്സും, ആയുർവേദത്തിൽ കർമ്മം കൊണ്ട് എത്തിപ്പെട്ട എന്നെയും എൻ്റെ പിതാവിനെയും പോലുള്ളവരും ആയുർവേദം ശാസ്ത്രീയമായി പഠിച്ചു വന്ന നിങ്ങളായാലും അതിൻ്റെ ഓജസ് വർദ്ധിപ്പിക്കാൻ കൂട്ടായി നിന്ന് പ്രയത്നിക്കണം എന്നതാണ് ഈ അവസരത്തിൽ പറയാനുള്ളത്. എന്തായാലും ഇൻട്രോ ഏകദേശം അവര് ആയുഷ് ഡിപ്പാർട്ട്മെന്റ് അയച്ചു തന്ന ചില സ്ലൈഡുകൾ നിങ്ങളെ ഒന്ന് പരിചയപ്പെടുത്താൻ, അതും ഇനി ഞാൻ കയറി ചെയ്യേണ്ട, നമ്മുടെ ഒരു ആയുർവേദ ഫ്രട്ടേണിറ്റിയിലെ ഒരു ആയുർവേദ ഫാക്കൽറ്റി ആയിക്കോട്ടെ വെച്ചിട്ട് ഡോക്ടർ മീരയെ ഏൽപ്പിച്ചിട്ടുണ്ട്. സോ ഐ വെൽക്കം ഡോക്ടർ മീര ടു ഹാവ് എ സ്നീക് പീക്ക് to the 9th World Ayurveda Congress, which is going to be conducted at Goa, Panjim, and I welcome all the Ayurveda fraternity to Goa in December. ഗോവ എന്ന് പറയുമ്പോൾ ബോയ്സിനൊക്കെ ഒരു ചെറിയ ചിരിയൊക്കെ കാണാറുണ്ട്. പക്ഷെ എന്തായാലും എല്ലാവരും വരിക. ലെറ്റ് സെലിബ്രേറ്റ് ആയുർവേദ. താങ്ക് യു.
Thank you, madam, for your inspiring words. Next, we have a short presentation, a sneak peek to 9th World Ayurveda Congress.
Thank you, ma'am.
അതിനായി PNNM ആയുർവേദ മെഡിക്കൽ കോളേജിലെ കൗമാര ഭക്തി വിഭാഗത്തിലെ അസിസ്റ്റന്റ് പ്രൊഫസർ ഡോക്ടർ മീര നായർ അവരുടെ ഏറെ സ്നേഹത്തോടെ ക്ഷണിച്ചു.
Thank you, sir. Good morning all. Let me give you a sneak peek or a brief to the World Ayurveda Congress 2022. World Ayurveda Congress, a global platform which was initiated in the year 2002, it showcases the advances in the relevant fields, orients students, and facilitates interaction between the professionals and consumers, thus boosting Ayurveda commerce. Our Honorable Prime Minister, Sri Narendra Modi, spoke at World Ayurveda Congress and talked about our commitment towards promoting Ayurveda and increasing awareness about the uniqueness. Let's see the previous World Ayurveda Congresses at a glance. We'll wait till the video comes.
Sorry for the technical delay.
First World Ayurveda Congress was held in Kochi in 2002, and it held nearly 1,800 number of delegates, and the slides. And it held nearly 2 lakhs of visitors in the Arogya Expo. And the second World Ayurveda Congress was held in Pune, Maharashtra in the year 2006. And it held nearly 5 lakhs visitors. It had nearly 5 lakh visitors in the pavilion. And the third Ayurveda Congress, which was held in Jaipur, Rajasthan, was a huge another success. Fourth World Ayurveda Congress, which was held in Bangalore in the year 2010, and it even held the number of delegates as 4,270. And the fifth Ayurveda Congress, which was held in Bhopal, Madhya Pradesh, and the sixth one, which was held in Pragati Maidan, New Delhi. Seventh World Ayurveda Congress, which was held in Kolkata. Eighth, which was held in Ahmedabad, were all a huge success. Now, going on to the 9th World Ayurveda Congress and Arogya Expo, which is scheduled to be in Goa, Panjim, during 8th to 11th of December 2022. There's a slight delay. in the slides. And the proposed venue of this World Ayurveda Congress is Kala Academy. Kala Academy is a prominent cultural center run by the government of Goa, situated in Kampal, Punjab. And the focal theme of this year is Ayurveda for One Health. The 9th edition of World Ayurveda Congress has this very important overarching theme of Ayurveda for One Health to provide a collaborative, multi-sectoral and transdisciplinary forum working at the local, regional, national and global levels to address the health issues spanning the entire spectrum of humans, animals, plants and their shared environment. Let's see, there are many components to the World Ayurveda Congress. They are there will be parallel sections, international delegates assembly, plenary sessions, conclaves, seminars, Arogya fair, public outreach programs. We know that the Arogya fair is the main attraction of the World Ayurveda Congress. And the proposed plenary sections, that is the small sessions which are to be conducted in the public, they are the invited lectures and Arogya for One Health, educational reforms, etc. And the themes for oral presentations, there are nearly 16 themes, which include very interesting theme like Pashu Ayurveda, commitment, compassion, and care. And the next one is associated events. Associated events include the seminar on medicinal plants, also traditional healers meet, and also the satellite seminars. The satellite seminars, there are about 20 satellite seminars will be organized across the country during August to October 2022 as a run-up of 9th WAC. These seminars will cover a wide range of topics and designed to propagate the World Ayurveda Congress and enhance the delegate registration. Of course, you all should register, are encouraged to register. And about these satellite seminars overseas, these are to be proposed during the time of September to October 2022, and these are to be conducted in 7 countries across the world: South Africa, Australia, Netherlands, Romania, Sri Lanka, Serbia, and Singapore. And all are encouraged to send your abstracts and papers, and the abstract should be submitted online at www.ioworld.org. This year, the expected number of abstract is more than 2,500, and for oral presentation, the expected number of delegates are 250, and for the poster presentation, 400, approximate 400 are to be expected. And now the important dates to remember. We know that the Ayurveda Congress is held at this December 2022 from 8th to 11th of this December, and the last date for submission of abstracts has been changed to 31st of August instead of 15th. So all are urged to send the papers, and the confirmation of abstract acceptance will be around 15th of September. And for poster submission and full paper and PPT submission, it will be the 10th of October. Now coming on to the very interesting session of the World Ayurveda Congress, that is the Arogya Expo 2022. This time, this Arogya Expo will showcase the achievements of Ayurveda. Around 300 plus stalls of educational institutions and of the industry will be there. And also, there will be Ayush Arogya clinics for free medical checkup, and medical plant sector will be there. Next will be the layout for the Arogya Expo in Panjim, Goa. And that is the venue layout. And this is the venue map. And here, the partners, institutions, patrons, associates, and collaborates. And it's a very happy occasion for our institution that our director, Mrs. Sandhya Manat, is the Kerala coordinator of the 9th VAC. Thank you.
Thank you, Dr. Meera, for your presentation. അടുത്തതായി ഉദ്ഘാടന കർമ്മമാണ്.
വേദിയിലേക്ക് ബഹുമാനപ്പെട്ട PNNM ആയുർവേദ മെഡിക്കൽ കോളേജ് സെക്രട്ടറി ശ്രീ M. മുരളീധരൻ സർ, ഡയറക്ടർ ശ്രീമതി സന്ധ്യ മണ്ണത്ത് അവർ, ബഹുമാനപ്പെട്ട പ്രിൻസിപ്പൽ Dr.T.Sreekumar സാർ എന്നിവരെ വേദിയിലേക്ക് ക്ഷണിച്ചുകൊള്ളുന്നു.
PNNM കോളേജ് സെക്രട്ടറി ശ്രീ M. മുരളീധരൻ അവർകളെ ഇന്നത്തെ സാറ്റലൈറ്റ് സെമിനാറിന്റെ ഔദ്യോഗിക ഉദ്ഘാടന കർമ്മം നിർവഹിക്കുന്നതിനായി സാദരം ക്ഷണിച്ചുകൊള്ളുന്നു. ഉദ്ഘാടന പ്രസംഗത്തിനായി കോളേജ് സെക്രട്ടറി ശ്രീ M. മുരളീധരൻ അവർകളെ സാദരം ക്ഷണിച്ചുകൊള്ളുന്നു.
ഈ ഓളിൻ്റെ അകത്തിരിക്കുന്ന ശ്രോതാക്കളെ, നിങ്ങൾക്ക് എൻ്റെ നമസ്കാരം. ഇന്ന് വേൾഡ് ആയുർവേദ കോൺഗ്രസിൻ്റെ സാറ്റലൈറ്റ് സെമിനാറിൻ്റെ നമ്മുടെ കോളേജിൽ വെച്ചുള്ള ഔദ്യോഗികമായ ഉദ്ഘാടനമാണ് നടന്നത്. പണ്ട് കാലത്തൊന്നും സാറ്റലൈറ്റിനെ കുറിച്ച് ആലോചിക്കാനേ പറ്റില്ല. ലോകത്ത് എവിടെ ഇരുന്നാലും ശരി, ഈ സെമിനാറിനെ കുറിച്ച് ആളുകൾക്ക് കാണാം എന്നുള്ളതാണ് ഇതിൻ്റെ പ്രത്യേകത, അല്ലെങ്കിൽ കേൾക്കാം എന്നുള്ളതാണ് ഇതിൻ്റെ പ്രത്യേകത. ഈ ആയുർവേദത്തിൽ സാധാരണഗതിയിൽ നൂറ്റാണ്ടുകളായി പാരമ്പര്യമുള്ള ചികിത്സാ സമ്പ്രദായം, അതിൽ ഈ ക്യാൻസറിന് ചികിത്സ ഉണ്ടോ ഇല്ലേ എന്ന് ഇപ്പോഴും പലരും സംശയിക്കുന്ന കാലഘട്ടം. പണ്ടൊക്കെ എന്ത് രോഗം വന്നാലും ചികിത്സിക്കും. ശാരീരിക അവയവത്തിൻ്റെ അന്ന് ഗുൽമത്തിന് ചികിത്സിക്കുക എന്ന് പറയാം. അങ്ങനെയാണ് സാധാരണഗതിയിൽ ചികിത്സ നടത്താറ്. ഞാൻ എൻ്റെ ചെറിയൊരു അനുഭവം പറയാം. ഞാൻ നേരിട്ട് കണ്ടിട്ടുള്ള അനുഭവം വെച്ച് പറയാണ്. വൈദ്യമഠം വലിയ നാരായണൻ നമ്പൂതിരി ഉണ്ടായിരുന്നു. വൈദ്യമഹോദതി എന്ന് പറഞ്ഞാൽ വലിയ പുരസ്കാരം കിട്ടിയിട്ടുള്ള ആളാണ്. സന്യാസി ശ്രേഷ്ഠന്മാരി അത്രയും പ്രഗത്ഭനായിട്ടുള്ള ഒരു വൈദ്യനാണ്. അടുത്തൂടെ പാഞ്ഞാളിൽ ഒരു റിട്ടയർഡ് തഹസിൽദാർ ഇതേമാതിരി ക്യാൻസർ വന്നിട്ട് മരുന്ന് കിടക്കാനേ പറ്റുള്ളൂ, ചെരിഞ്ഞ് കിടക്കാൻ പറ്റില്ല. മരുന്ന് കിടന്നാൽ തന്നെ വയറിങ്ങനെ വന്ന് ശ്വാസം മുട്ടിയിട്ട് സൈക്കിളിലെ വേദനയും ഭയങ്കരം. അദ്ദേഹത്തിൻ്റെ അനിയനും തഹസിൽദാരാണ്. ഇവരെല്ലാവരും കൂടി അന്ന് തിരുമേനിയെ കാണാൻ സമാജത്തിൽ വന്നു. എങ്ങനെയും ഒന്ന് രക്ഷപ്പെടുത്തണം, തമ്പുരാൻ ആളെ കൊണ്ടുവരാൻ മാർഗമില്ല എന്നൊക്കെ പറഞ്ഞു. അദ്ദേഹം അങ്ങനെ വീട്ടിൽ പോയി പരിശീലിക്കുന്ന ആളല്ല, എങ്കിലും അങ്ങനെ വീട്ടിൽ പോയി നോക്കിയിട്ട് അദ്ദേഹം നല്ലോണം ആളെ പരിശോധിച്ചതിന് ശേഷം പറഞ്ഞു, മാറി നിന്ന് പറഞ്ഞു, 5 ദിവസത്തിൽ കൂടുതൽ ഈ രോഗി ജീവിക്കില്ല, കൃത്യമായിട്ട് നിങ്ങൾ കണക്കെടുത്തു. പക്ഷേ ഈ 5 ദിവസം അയാൾക്ക് യാതൊരു ബുദ്ധിമുട്ടും ഇല്ലാതെ അയാളെ മരിപ്പിക്കാൻ ഈ ശ്വാസം മുട്ടലോ വയറ് വീർപ്പോ വേദനയോ ഒന്നും ഇല്ലാതെ ഞാൻ അങ്ങനെയൊക്കെ മരിപ്പിക്കാനുള്ള സഹായം ചെയ്ത കാരണം. അങ്ങനെ എന്തോ മരുന്ന് കുറിച്ച് കൊടുക്കും. ഞാൻ വൈദ്യനല്ലാത്തതുകൊണ്ട് എനിക്കിപ്പോൾ അതിൻ്റെ ആവശ്യമില്ലാത്തതുകൊണ്ട് എന്ത് മരുന്നിനെ കുറിച്ച് കൊടുത്തതെന്നൊന്നും ഞാൻ ശ്രദ്ധിച്ചിട്ടില്ല. പക്ഷെ മരുന്ന് കുറിച്ച് കൊടുത്തോടുകൂടി പിറ്റേ ദിവസം ആകുമ്പോഴേക്കും വയറ് കംപ്ലീറ്റ് കൊണ്ട് ഒതുങ്ങി. വയറ് ശ്വാസം മുട്ടലിൽ നിന്നും വയറുകൊണ്ട് ഒതുങ്ങി അവിടെ നല്ലോണം അമർന്ന വയറായി മാറി വേദനയില്ലാണ്ടായി ആൾ മരിക്കും ചെയ്തു. 5-ാം ദിവസം പറഞ്ഞമാർ ആൾ മരിക്കും ചെയ്തു. അപ്പോൾ ഇതിനൊക്കെ മരുന്നുകളുണ്ട്. ഇതൊക്കെ നേരത്തെ കൂട്ടി കണ്ടെത്തി കഴിഞ്ഞാൽ നമുക്ക് ചികിത്സിക്കാനുള്ള സൗകര്യങ്ങൾ ആയുർവേദത്തിലുണ്ട് എന്ന് നമ്മളെങ്കിലും മനസ്സിലാക്കേണ്ട ഒരു കാലഘട്ടം വന്നിരിക്കുക. ഇപ്പോൾ ഓൺകോളജി മോഡേൺ മെഡിസിനെ സംബന്ധിച്ചിടത്തോളം വലിയൊരു പരിഭ്രമമില്ലാത്തൊരു സബ്ജക്റ്റായി മാറിയിരിക്കുക. 1,00,000 രൂപ ഒരു ഇഞ്ചക്ഷൻ എടുക്കാൻ പറ്റുന്ന ആൾക്കാർക്കൊക്കെ ഇപ്പം രക്ഷപ്പെടാമെന്നുള്ള സ്ഥിതിവിശേഷത്തിലെത്തിയിരിക്കുക. ഇതല്ലാതെ തന്നെ ആയുർവേദം കൊണ്ട് തന്നെ ഇവിടെ ശ്രീകുമാർ സാർ ചികിത്സിക്കുന്നുണ്ട്. നമ്മുടെ കോളേജിൽ ഒരു ആയുർവേദത്തിൻ്റെ റിസർച്ച് വിങ് തുടങ്ങിയതാണ്. അത് ഈ കൊറോണയിൽ കൂടി വന്നപ്പോൾ തൽക്കാലത്തേക്ക് നിർത്തിവെച്ചപ്പോൾ രണ്ടാമത് അത് തുടങ്ങേണ്ട കാര്യത്തെക്കുറിച്ച് ആലോചിച്ച് വരികയാണ്. ഇതെങ്ങനെയാണ് ഈ രോഗം ഉണ്ടാവണമെന്ന് ഇന്ന് വരെ കണ്ടുപിടിക്കാൻ പറ്റിയിട്ടില്ല. വന്ന രോഗത്തിനുള്ള ചികിത്സയെക്കുറിച്ച് മാത്രമേ ഇപ്പം നമ്മൾ ചിന്തിക്കാറുള്ളൂ. ആയുർവേദം രോഗം വരാതിരിക്കാൻ വേണ്ടിയിട്ടുള്ളൊരു വിദ്യയാണ്. വന്നതിൻ്റെ ശേഷമുള്ള ചികിത്സ രണ്ടാമതേ വരുന്നുള്ളൂ. ഒരു മനുഷ്യനെ സംബന്ധിച്ചിടത്തോളം അയാൾ രോഗി അല്ലാതാവാൻ ഉള്ള മാർഗങ്ങളാണ് ആയുർവേദത്തിലെ പ്രധാനം. 2-ാം സ്ഥാനമാണ് വൈദ്യത്തിനും 2-ാം സ്ഥാനമാണ് മരുന്നിനും കൊടുക്കുന്നത്. അപ്പം നമ്മളിത് ക്യാൻസർ വരാതിരിക്കാൻ വേണ്ടി മുൻകൂട്ടി എന്തൊക്കെ ചെയ്യാൻ കഴിയും എന്നൊരു പഠനം നടത്തേണ്ട ഒരു ആവശ്യം വന്നിരിക്കുന്നു. വന്നു കഴിഞ്ഞാൽ ഇത് എങ്ങനെ നമുക്ക് മറ്റുള്ളവർക്ക് ബുദ്ധിമുട്ടില്ലാണ്ടിരിക്കാനും സ്വയം ബുദ്ധിമുട്ടില്ലാണ്ടിരിക്കാനും ഇതെങ്ങനെ മാറ്റാൻ കഴിയും എന്ന് ചിന്തിക്കേണ്ടിയിരിക്കുന്നു. അതായിരിക്കണം സെമിനാറിൻ്റെ മുഖ്യ വിഷയമെന്ന് ഞാൻ വിശ്വസിക്കുന്നു. ശ്രീകുമാര സാറും മധു വാര്യർ 2 പേര് സബ്ജക്റ്റ് അവതരിപ്പിച്ചിവിടെ സംസാരിക്കുന്നുണ്ട്. ലോകത്തിൻ്റെ പല ഭാഗത്തുള്ള ആളുകൾ വളരെ ശ്രദ്ധയോടുകൂടി ഇത് വീക്ഷിച്ചിരിക്കുകയാണ് ഇവരുടെ സംസാരം അറിയാൻ വേണ്ടിയിട്ട്. അതുകൊണ്ട് അവരെ ഞാൻ ഈ കാര്യത്തിൽ പ്രത്യേകമായി അഭിനന്ദിക്കുന്നു. ഇങ്ങനൊരു സാഹചര്യം അവർക്ക് ലഭിച്ചതിന് വേൾഡിലെ എല്ലാ ആളുകളും ഇവരുടെ ശ്രദ്ധ ഇങ്ങോട്ട് തിരിക്കാൻ പറ്റിയതെന്ന് ഞാൻ അവരെ അഭിനന്ദിക്കുന്നു. ഈ സെമിനാർ ഏറ്റവും ഭംഗിയായി അവസാനിക്കട്ടെ എന്ന് ആശംസിച്ചുകൊണ്ട് ഉപസംഹരിക്കുന്നു. ഇതിൻ്റെ ഔപചാരികമായ ഉദ്ഘാടനം നടന്നതായി പ്രഖ്യാപിക്കുന്നു. നമസ്കാരം.
നന്ദി സർ. Now we are moving to the scientific session. ക്യാൻസർ മാനേജ്മെന്റിൽ ആയുർവേദത്തിന്റെ സാധ്യതകളെ കുറിച്ച് ഒരു പേപ്പർ പ്രസന്റ് ചെയ്യുന്നതിനായി ബഹുമാനപ്പെട്ട PNNM ആയുർവേദ മെഡിക്കൽ കോളേജ് പ്രിൻസിപ്പലും ശല്യതന്ത്ര വിഭാഗം ഹെഡ് ഓഫ് ദി ഡിപ്പാർട്ട്മെന്റുമായ Dr.T.Sreekumar സാറിനെ സാദരം ക്ഷണിച്ചു. I invite Dr.T.Sreekumar. I invite Dr.T.Sreekumar, sir, a well-known academician, a specialist in anorectal management, and also a specialist in cancer management. Also, our beloved Vice Principal and the Head of the Department of Salyatantra, PNNM Ayurveda Medical College, to present the paper. Thank you.
Respected Chairman Murali sir and Mrs. Sandhya, the Director of PNNM Ayurveda College, for hosting this function on behalf of World Ayurveda Congress, 9th program, as the 9th program, in anticipation to the main program which will be held in Goa during December. So let me outright start my topic. The topic which is earmarked for me is principles and practice of oncology in Ayurveda. We know that cancer is hailed to be the emperor of all maladies. It is the emperor. It is not only the king, the emperor of all maladies. Majority of the cases. We know that most of the cases are managed by the Western medicine now. Ayurveda has also got its own slot in the management of cancer. But it is a pathetic issue that the role of Ayurveda in the management of such a complicated condition is not yet put to research properly. The reasons of which are dubious, are not clear. India can boast that there are approximately 8 lakhs new cases occurring each year, and that around 2,40,000 cases are there in India at a given point. See, for example, now there are 2,40,000 cases. See, it is such an alarming. It is in such an alarming phase that the number of cases are progressing, and the 5-year survival rate of India are not much to be boasted. It is far less than in the developed countries. That means only 70%. One issue we have to remember is that the earlier the stage in which the cancer management starts, the better the rate of cure. Means at least in the case of lung cancer, if management is started in the first stage, there is a chance of 87% of survival rate, whereas in stage 4, it is decreased to 19%. These all statistical data are taken from the Cancer Registry of India. And the main issue, what exactly is cancer? It is not only for the youngsters and beginners that I am speaking about the definition of cancer. I have read this definition from the Hamilton Bailey's text, you all know, Short Patches of Surgery, around 35 years ago, that cancer is a disease of the genes. At that time, when I have gone through it, I thought that there is some lacuna in it. It is not a full definition. We have to contribute something else into that definition. But no, the more mature we become, the more definition, that small definition, it is more definite and more relevant. Cancer is a disease of the genes. Cancer is a disease of the genes caused by changes to genes that control 3 factors. Number 1, cellular function. Number 2, cellular growth. And number 3, cellular division, cell division. So these 3 factors, the genes controlling these 3 factors are affected in the genesis of cancer. So much so that cancer is yet, it is defined as the disease of the genes. These changes collectively occur at the level of the DNA. And this is called, collectively, this is called as mutation. So what is mutation that will come to? Cancer is not a solitary disease. We are just collecting so many diseases, like for example, at least 100 diseases into the wider umbrella of cancer. This one name, because all these share certain common features. Those common features also will come to. We have been speaking about mutation. What's meant by mutation? Mutation is an alteration of the nucleotide sequences in the genome of an organism. And usually the mutation occur at the level of the DNA copying. Mistakes occur during the copying of the DNA, during cell division, due to a variety of factors, including, we all know about ionizing radiations, then exposure to mutagens, that means chemicals, including that in the cigarette smokes, including that in so-called Indian-made foreign liquor, etc. And of course, very rarely in certain viral infections also. We have been speaking about certain commonalities in the genesis of cancer. These are collectively called as hallmarks of cancer. Previously, in one time, there were only 6 hallmarks mentioned. Later, it was increased to 10. Now it is somewhat like 13 hallmarks of cancer are there. Hallmarks constitute the biological capabilities acquired by the tumor during its development. During its development means multi-stageal development. It is the power of cancer. All these are the powers of cancer which they attain, which the cells of cancer attain during their development. And these hallmarks serve as an organizing principle for rationalizing the complexities of neoplasia. You know what is meant by neoplasia? Neoplasia, new growth, plasm growth, cytoplasm. So these are the organizing principles. See, initially, Douglas Hanahan, who explained the hallmarks, only put some 10 hallmarks. Cell division through selective proliferative signaling, evading growth suppressors, evading apoptosis. Apoptosis, the ability of the cell to die, that is bypassed. So cancer cells gain a particular momentum that they will not die, they just will multiply. So evading apoptosis, enabling immortality, replicative immortality, then angiogenesis, micro and macro metastasis, bus. These 3 were the initial hallmarks. Then in 2011, when these were updated, it was updated by Robert Weinberg along with Douglas Hanahan, who enabled 4 other hallmarks also. Metabolic rewiring. There's a metabolism of the body, but the cancer rewires the metabolism, renews that metabolism. Then avoiding immunosurveillance, genome instability, and tumor promoting inflammation. Yet another 3 factors are also there, like supporting tumor microenvironment, altered stress response, and communication between the primary and secondary sites of cancer. There is a communication between the primary site and the secondary sites. So it is one of the complexities of cancer. Again, in January 22, this year, it was again updated. It was my students who told me that it was updated. I didn't know about it. Then the important update which was made was phenotypic plasticity. What's meant by plasticity? Plasticity means that it is the ability of the cancer cell to be of its own type. Depending upon the circumstances, it can change. It can change not only the size and shape, but also its metabolism also. Not only its metabolism, it can go backward, it can come forward, or it can live there dormant for any number of years also. 3 factors were proposed by Sylvia Lizuzzi in American Academy for Cancer Research. Number one, the power to de-differentiate. The power to, not the power to differentiate, the power to de-differentiate, to go back and to stand still like that, to halt the differentiation process and to trans-differentiate. Trans-differentiation means one type of a cell, maybe it may be a, say for example, a liver cell. It can be a neuronal cell, means it's the ability to trans-differentiate. So this is a peculiar type of ability attained by the cancer cell. Then coming to Ayurveda, the wonderful question is whether cancer is a Nijaroga or Agandaroga. Cancer is a Nijaroga, cancer is an Agandaroga as well, and cancer is what one time a Nijaroga, another time an Agandaroga also. So it does not come under the what I call the disciplined environment of either Nija or Agando. It's trailing a dual, or you can call it a triple pattern for its Nidana. The factors for the metamorphosis of a normal cell to a cancer cell is not very easy, we should understand. To metamorphose to a normal cell, to metamorphose into a cancer cell means it is not very easy. It should defeat the immunosurveillance of the body. It is a very difficult process. And this is the Samprapti in making of the cancer cell. Samprapti means it all depends upon the genetic factors also. A person who is smoking for 25 years, 30 years, 40 years, 50 years, he may not get cancer. Whereas a person who has just smoked for 10 years, he will get cancer. Why? Why? Because there is a genetic factor involved. That genetic factor plus the predisposing factor, whatever it be, cigarette smoking or whatever it be, that is the mixture is the main cause behind the Samprapti. And Samprapti also can be defined as a continued indulgence. Once upon a blue moon, if you smoke or if you drink or if you indulge in carcinogenic substances, you may not have cancer. But the more and more you involve in it, the more and more chances are prone for cancer. The Samprapti when started, but it is very difficult to start the Samprapti. When the Samprapti has already been started, it is extremely difficult to stop also. It is very difficult to manage this thing. So we know that modern science has done wonderful research upon cancer right from the 40s, early 40s. They are doing research in cancer. And we know that the majority of the cases are being managed by Western medicine. Then what is the novelty of Ayurveda? Then what is the role of Ayurveda? What is the significance of Ayurveda in cancer management? People will ask. This is my answer. That anti-cancer therapy in modern medicine or in Western medicine, I will tell, is equated to removal of the mass by cytotoxic drugs, surgery, or radiotherapy. Three principal weapons they have got. Number one is cytotoxic drugs. Number two, surgery, downsizing by surgery or by radiotherapy. But however, these three management patterns does not address the cause for mutation. That is the issue. Like cutting the tree of cancer without destructing its roots. You are cutting the tree, but the roots are not destructed. There is a chance for recurrence also. That is the main issue. Hence, failure rates and recurrences are far too common. In Ayurveda, the aim of cancer treatment, according to we people, here we have got a department or an institutional setup to manage cancer in Ayurveda. So what we are doing here is, our aim is this, or our aims are all these. Number one, to destruct the cancer cells. In Western medicine, they call cytotoxic, but I would like to call our medicines cytolytic rather than cytotoxic. then to improve the immunity, to prevent the metastasis, and to prevent recurrence. How? By optimizing the dhadus. Dhadus have to be optimized. For optimizing the dhadus, so many other things are to be done, of which we will come to. So these are the aims which we have arrived at. The projected scope of Ayurveda thus is compartmentalized into three. Number one is prevention, number two is cure, and number three is to maintain manageability at least, if you cannot cure it. Many people equate cancer with Arbuda, because there is a mention of Arbuda in the classical literature, of which I'll also come to. But I would like to equate cancer more to Vata Shonida. Look at the Vata Shonida of Nidana. Vidakhinam, Viruddham cha, Tatra cha Asar Pradoshajam, Pajadam Vithihenam cha Sopana Jagara Maithunam, Vithihena Sopana Jagara Maithunam. Sopana Jagara Maithunam, we have given a separate compartment as Traya Upastambha. That means pollution of Traya Upastambha. Kalandarena Gambhiram, Sarvan Dhatuun Abhidravan, exactly cancer. Sarvan Dhatuun Abhidravan, Tridoshajam, Tejet Sravi, Stabdham Arbudagaricha. Here comes the word Arbuda. The word Arbuda mentioned here can be equated with cancer. But the disease Arbuda, which is mentioned somewhere else in Uttarasthana, cannot be directly correlated with cancer, what I feel. I may be wrong. Then Bhutva Pranashyandi Muhura Avirbhavandicha. All these are typical identities of cancer, which is mentioned in Vata Shonida Nidana. And how to prevent it. We all will tell that cancer can be prevented by preventing carcinogenesis. And how carcinogenesis can be prevented? By healthy, desirable food, drinks, and regimen. Healthy, not only healthy, but desirable. Pathya. Healthy and desirable food, drinks, and regimen. Then the most important thing than those, what I feel is straightforward, honest nature. Many of us has not got this straightforward and honest nature. Straightforward and honest nature of the patient. These two are vital in the prevention of cancer. Our own science has given dictums as to how to prevent the disease and how to prevent its recurrences. Tyaga pratnya aparadhanam indriyopashama smriti, desha kalatma vijnanam sadvruttasya cha anuvartanam, anulpatti samasthana vidhiresha pradarshita, nijagantu vigaranam, ulpananam cha shandaye. And this also, nityam hita ahara vihara sevi, samekshagari. Sameksha means samyak ichya. Samekshagari, visheshu asaktaha, dada, para, satya, dada, sama, satyapara, shamavan, aptopasevi cha bhavatyaroga. This is very important in the prevention of not only cancer, but all the diseases, but especially cancer. And summing everything up, how to prevent cancers and its relapse. Number one, following the Shodhana Karma as per Ridhucharya. Very easy. Following the Shodhana Karma as per Ridhucharya. At least those who are having the disease. Avoiding Nidanakara food like synthetic sugars, Viruddhahara, high protein food, food loaded with Katu Amla Lavana Rasas, etc. Sticking to the Pathya regimen of food, exercise, sleep, and sex, what we have told just now. And last but not least, relaxation of the mind. Relaxation of the mind. Simple pranayama of yoga. Simple breathing exercises, I am telling you. Not the complicated yoga postures, etc. Simple pranayama procedures. Concentrating upon the relaxation of mind. That is very important. Mind is important than the body. Then comes the cure or maintenance of manageability, of which I am going to talk today. Number one, drugs. Number two, therapeutic regimens or programs. Then here also comes positive thinking, exercises for physical and mental well-being, and last but not least, Rasayana. Our slot in oncology. We have got our slot in any stage of the disease. That is there, in any stage of cancer. But we, first of all, should have a platform of concrete diagnosis. What exactly is this disease? The diagnosis should be there. Modern diagnosis itself. We should have the power to translate it to our science, that's all. All the most modern knowledge is welcome, but we should be able to translate it. Unless otherwise, what can we do without that translation? So a bridge should be put between the most modern sophisticated knowledge and our traditional science. Then we can do something about it. Not only something about it, we can do much about it. And I have to tell you, from my experience, it is always better to avoid most of the freshly diagnosed cases, because our treatment suits the terminal cases best. We can do our treatment in cases which are diagnosed, which are on allopathic treatment, and which are after conventional treatment, to avoid metastasis or recurrences, because metastasis and recurrences are a common feature in this disease. Oral use of medicine should be possible. That is the only issue behind our treatment, because we have to give medicines, most of the medicines, orally. Nowadays we are thinking otherwise also. We are thinking to give medicines through the nasal route also, and basti also. But anyway, most of the medicine should be given orally. So in patients who are on Ryle's tube, it is very difficult to give our medicines. Then people call this palliative. Our treatment palliative. Is it palliative? I don't think so. Palliative is a name given to a particular type of management where the person is going to just to die and he is allowed to die. Our treatment is not like that. Our treatment is Hastalambopishagitam. We are trying to bring back the persons. I'll show you certain clinical examples tonight. How to bring back the cases to life. And any possibility to cure would be explored. Then Arbuda. If you want to name the Arbuda, that also we can take. Arbuda management in the classics. So all our three acharyas have given management. And Charaka has mentioned. It is Charaka who has mentioned Padana, Dahana, and Varna Chikitsa, not Sushruta. And Sushruta has given separate management for each types of Arbudas. He has given a list of so many types of Arbudas and separately. One thing Vagbhada has given, that yoga we have not used till now. We have not manufactured that yoga. He has given a wonderful yoga. Brahadi Chitraka Vyakri Kanas Siddhena Sarpisha Snehapanam. We have not done it so far. It is time that we have done something about it. Yes, that is the management in classics. But however, I would consider that the Arbuda is a misnomer. Arbuda is not cancer. There is some differentiation between Arbuda and cancer. In those times, Arbuda is there. Arbuda, it is not that I am not telling that cancer was not there in those ages. Cancer was there. It is mentioned somewhere hidden or open in so many diseases, in so many stages of the diseases. There are plentiful examples of which I can give you, but I'm not going into such details now. The issue of cancer can be addressed on a wholesome perspective if principles of Ayurveda are adopted in Ayurvedic oncology. See, this is one of the important questions which are raised by the new generation of practitioners. Is Arbuda, if Arbuda is that much serious a condition, Shodhana Chikitsa should be done. Without Shodhana Chikitsa, with Shamana Chikitsa only, how can you manage such a complicated condition? It is correct that according to the condition of the patient, Shodhana therapy should be done. That is the apt therapy. But unfortunately, the clinical condition of the patient warrants Shamana Chikitsa only. That is a core issue, because so many comorbidities will be there, so many associated diseases will be there, independent to cancer also, so that Shodhana therapy could not be done. Because I will come to the clinical aspects. Many of the patients are cachexic. They are severely anemic. They cannot even stand on their own legs. How can Shodhana therapy could be done in such individuals? That's the main issue. The Western studies done so far aim at, we have already told, aim at destruction of the cancer cells only by cytotoxicity. Other factors like improvement of immunity, prevention of metastasis, prevention of recurrence, of cleansing the body, and more important than that, cleansing of the mind, rejuvenating the body by Rasayana, which all come under the wider umbrella of Ayurveda, are not put to test so far. I will speedily go through all these things. Number one, destruction of cancer cells by Ayurveda. The various modes are: number one, by cytotoxic single herbal drugs. I told you cytotoxic is not my word, cytolytic is my word for it. Okay, cytotoxic single herbal drugs like Bhallataka, Snuki, Ushamalari, Chitraka, etc. According to the, I am not telling that you can make a decoction of all these things and give in all the cancer cases. The drug should be individually tailored and selected to suit the individual condition, to suit the individual patient, not the individual disease. For all stomach cancer, there is not a single drug in Ayurveda. We have to select the patient, and accordingly we have to tailor the drugs chosen. By cytotoxic compound herbal drugs like Surasadigana, Surasayuga Phanijam, Karama, Vidagam, Karabsa, Rashagarni, Katpalo, Kasamarda, that medicine. Then Rasaushati is like Chandamartha Sindhura, CMS, which we will call herbal drugs plus Rasaushati as a vehicle, use of Sirasa Sindhura to convey the active medicinal ingredient of herbal drugs to the site of action. Kapahara drugs like Neem is not a Kapahara drugs alone, Kapahara drug alone. It is a wonderful anti-cancerous drug. There is no doubt about it. Plenty of examples I have to give you. Neem, Haridra, Tulsi, Paranti, Paribhadra, Kanjanara, Jadi, etc. Jadi means not the fruit of Jadi. Jadi Pallava, the other thing. Then by drugs of specific site action, we will go to the next slide for details. And by charas, which is the dominant point in my today's talk. For example, go to the chara in the cancers of KUB. There are a host of cytotoxic drugs, specific cytotoxic drugs, specifically for each organ. These are just a collection of plenty of other medicines are also there. Name, for example, for all cancers, especially bone and skin cancers. Bone and skin means, yes, Vata related. The more Vata related conditions, name. Then Guluji for GI tract cancers, including cancers of the liver. Sahadevi, especially for liver cancers alone, whether it be primary or secondary. Kanchanada for lymphomas and such types of growths. Then Paranti, Tulsi, Jadi, Nitya Kalyani, etc. for myelomas, multiple myeloma, I mean. Then Pipali for Pipali Vartamana Prayogam for lung cancers, if the patient is that much healthy. Gochira plus Vrachadani Charayavagu, which I have given for prostate cancer with excellent results. Then Rasa Sindhura for augmenting action of all drugs. So these are just a cross section of what we have, the data we have gathered. Then there are other drugs also for according to types of cancer. For example, fresh neem is generally given for adenocarcinomas. Then Bhalladaga is generally given for squamous cell carcinomas, but not squamous cell carcinoma alone, that we know, but generally Then Catharanthus roseus for Nitya Kalyani we give for leukemias, and Clerodendron infortunatum for the so-called gynecological cancers, means cancers of the breast, uterus, etc. And Adivisha for stomach cancers, and Vacha for neurogenic cancers. And how it is acting? How is acting? We don't know, frankly speaking. But to the knowledge which we have got now, I will tell you that many herb-derived alkaloids are currently in active use in oncology. For example, Vinca group of medicines that taken from Catharanthus roseus is used in all types of cancers now. In most of the cancer cocktails, they are calling cocktails. This plus this plus this, this plus this plus this. Many types of cocktails are there. See, Vinca is an important medicine ingredient in these types of cocktails, and it was found in 1940 or so, something like that, 43 or 44. It was invented. It's not our drug. It's not. It is just a herb. That's all. It's not an Ayurvedic drug. No mention of Catharanthus roseus is there in Ayurveda. And Ayurveda drugs has been screened for anti-neoplastic activity. Many drugs has been screened, and many of them were found to be effective in in vitro experimental and clinical setups. Selected medicines, most of the medicines which I am going to tell you are in use for at least 20-25 years by me personally. Then coming to herbo-mineral drugs, we have to understand that experts in Rasa Shastra are here and there. I can find. I'm not encroaching the boundaries, but I'm just to tell you that while preparing Rasa Shastra medicines, we are adding organic medicines also into it for Shuddhi Karma and Marana Karma. For increasing bioavailability. That is what we usually tell. It is for increasing bioavailability that we are doing Shodhana and Marana of a chemical. And mercury is a chemical, we all know. And most of the medicines which we are being used are chemicals. These chemicals as such cannot be given to the body. What happens? That will cause death, or that will cause immediate complications. For avoiding that, we are taming those chemicals with the use of herbs. So the end product is harmless to the healthy body tissues if used judiciously. If used judiciously, these are healthy to the body. These are not causing any complication to the body. However, they are still harmful to the mutated cells and tissues, thus competent to control cell proliferation issues. That is our topic here. If used judiciously, even judiciously, they will be harmful to the mutated cells and tissues, thus competent to control cell proliferation issues. They also act as catalysts to herbal drugs also. For example, we are giving Rasa Sindhura with many of our drugs. The specific mineral drugs which are being used by us. I'm again telling you that I'm not an expert in Rasa Shastra, but we are using these drugs for certain types of cancers. For example, Talaka Basma, Haridala Basma for lymphomas, Suvarna Basma for leukemias. Yes, Suvarna Basma for leukemias. Abraga Basma for bronchogenic cancers. Tamra Basma for very minimal doses. Tamra Basma for hepatocellular carcinomas. Yashada Basma for pancreatic cancers, and Shilajado for cancers of the KUB. Then the dictum of using Kapha Vata Hara drugs in oncology is this is the dictum. Number one, errors of cell division and mutation of genes. That is the primary issue in cancer. These are caused by aberration of Vata, by Bija, Avayava, Dushti. We know. It is mentioned specifically in Charaka Samhita. Growth of new tissues can be attributed to Kapha also. So Vata and Kapha are the principal. Maybe Pitta is also involved. I am not telling that because it's a Tridoshaja condition. Even Rakta also is involved. That is another thing. But principally the origin of cancer is from issues of Vata and Kapha. Thus, Vata and Kapha are to be synergistically controlled. You all know what is the meaning of synergistic. Synergistically controlled. And the guna employed is principally Tishna guna. Of course, the drugs without Tishna guna also we are giving for treatment, like Vidarya, Digana, Kvata, etc. That is another thing. In certain conditions we have to give. Then Paniyakshara. Paniyakshara is the main theme of study here in our college, because Paniyakshara is a systemic fortified alkalizer. Systemic and fortified alkalizer. It alters the chemistry of the body to be unfit for cancer cell proliferation. For any cell proliferation, we know that kapha has to be increased. Kapha is increased with which rasas? Kapha is increased with madhura rasa, amla rasa, lemon rasa, etc. But here we are giving chara. Chara is against all these things. Chara will control and chara will annihilate kapha. And it will immediately go to the site of action, because it has got Vyavayu guna also. So it alters the chemistry of the body and makes cancer cells unfit for proliferation. This is the profiling of chara for its use in cancer. The unique concept of anti-cancer effect of chara based on systemic alkalinization is this. Number one, chara is lytic. Charanat charaha, charanat charaha. We all have studied all those things. Charanam, charanam. It is more lytic to reproductive tissues. Means it is pumstonashana. That mention is in Suchara Samhita only. Pumstonashana. Reproductive tissues are among some of the tissues of the fastest turnover, with the exception of small intestine tissues. Cancer cells are of latest origin and of fastest reproduction. Hence, this is a hypothesis that chara should be lytic to cancer cells. The cells which are actively undergoing cell cycle are targeted in Western chemotherapy, are targeted in cancer therapy, as the DNA is relatively exposed during cell division and hence susceptible to damage by drugs and radiation. It is this theory that we have baptized into our own treatment also by chara. Thus, the negative effect of pumstonashana of Paniyakshara is made a therapeutic tool in the cancer management by administering it with carbohydrate-rich Yavagu. We are giving chara, Paniyakshara, along with Yavagu. Yavagu, we know many medicines are given as Yavagu. The mention of it is in Charaka Samhita Sutrasthana. We have taken that procedure also. Means it is to be, whenever you are giving any Yavagu will enter all the srotases with ease than fat or proteins. And because Yavagu is tuned with alkalizers, the alkalizer will go into each and every tissue. This is the dictum which we are practicing. Then the number 2 is improving immunity in cancer patients. Cancer is a fight between our own body and the mutated cells. It is really a fight. The fight is inside. That is the issue. The fight is not outside the body, from within out. It is within inside itself. So we may not be able to realize that that fight is going on for years and years. That is the main issue with cancer. Our aim is to help the body to win the fight. And this can be attributed to the immunity which we have got. The immunity which we in Ayurveda call Ojas or Bela in Ayurveda. Immunity of the body from the cytotoxic effects of the cytotoxic drugs, and immunity to keep the comorbidities at bay. Improving immunity by medicines means there are a variety of, we have got much drugs for improving immunity. There are certain single drugs, like for example, Godoji, Ashwagandha, etc. And there are compound preparations like Indugandham Kvadha, Indugandham Gradha, etc. There are rasayanas also solitary rasayanas like Shilajit are there, and compound rasayanas are also there, like Brahma rasayana. Then there are certain drugs which are specifically Vata Kapahara, like Pipali, which those drugs we are giving as Vardhamana Prayoga in Rasayana. Improvement of immunity can be by dietary regimens as well, with the inclusion of Dadima, Kushmanda, Padola, Amalaka, Ardraga, Tatra, Shashtiga, Godhuma, etc. in the diet. Then it can also be increased, immunity can also be increased by the practice of yoga, by the continuous practice of yoga, not for one day, but you have to continue the practice of yoga along with the practice of sadvritti. In the morning, we are practicing yoga. In the afternoon, we are after somebody, chasing somebody. It should not be like this. Sadvritti, Ajara Rasayanam. Ajara Rasayanam is simply positive mindset. Then prevention of metastasis. Metastasis is, we all know, we have studied the Kshatriya Gala. It is Navasthana Samshraya. Doshas will migrate to a new location only if the momentum is got. A momentum is to be got by Vada. Otherwise, it cannot move. Pangu, it will be Pangu. Momentum of Vada is to be got. Then only it will get the power to migrate. And if a suitable site is located for growth, Vada and Kapha are to be controlled thus. Our aim is to minimize the momentum of cancer seedlings and to make any other site unfavorable for the growth of cancer. Srodorotha is to be avoided. Drugs used can be Vata Kapahara, like for the prevention of metastasis, it can be Billua, Pipali, Lashuna, Haridra, etc. For each indication, there are separate drugs in Ayurveda. Prevention of recurrence, other drugs are there. Recurrence occurs when the factors suitable for mutation still exist in the body. Otherwise, recurrence will not occur. We have removed a lot of region because it is cancerous. But still, if the condition remains in the body, still again recurrences will be there. These factors are to be identified and annihilated. For that purpose, Pathya food and regimen and also Rasayana are our tools, like what I have told, Dadima, Kushmanda, etc. And following of proper Dinacharya, and Ajara Rasayana. Even when I am telling about Ajara Rasayana, it becomes Ahara Rasayana. That is the issue. Because they are not following it properly. That is the basic issue. The practical aspects to avoid cancers and its relapse is to follow Shodhana therapies as per the area, as possible. It is not that in each and every case it is possible. If possible, we should do it. Avoiding Nidanagara food like synthetic sugars, Viridhahara, etc., and sticking to Pathya food and regimen, etc., relaxation of mind, etc. Then, optimization of dhadus. For optimization of dhadus, the single and solitary answer is Rasayana. Rasayana ensures premium quality dhadus by selective nutrition. We have studied it. But in the context of cancer, it gains special significance. Umpteen Rasayanas mentioned, like Narasimha Rasayana, Amalaki Rasayana, Brahma Rasayana, Chavanaprasha, etc., as the compound Rasayanas, and single Rasayana, Brahmi Rasayana, Ashwagandha Rasayana, etc. Single Rasayanas. Rasayana, its aims in oncology practice is to bring premium quality tissues by selective nutrition and micro-targeting with macro-rich. And it attains all the three Rogamargas, the ectoderm, mesoderm, and endoderm. It tunes apogis. The target of Rasayana therapy is correction of mitotic errors. This is the main target. Rasayana tool is properly used, DNA damage issue can be solved, thus recurrences can be aborted. Only Rasayana can repair the damage of the stem cells or their genes. There is no other mechanism to repair the stem cells. not in any system of medicine, but in Ayurveda only. This rasayana can repair the damage of the stem cells. It helps to build up the organs. It helps to fight aging. It rejuvenates the body. It boosts up the immune system to fight cancer cells. Example, Pipali Vardhamana therapy. And the definition of rasayana itself is labhobayo hi shastanam rasadinam rasayanam. Dr. Madhu Varier has come. He is a coveted speaker today. We all are anxiously waiting to listen to your precious talk. The classical prerequisites of cancer rasayana therapy is that one should have undergone Shodhana therapy, but this is not possible in many instances in the purview of cancer. For this, prior Snehana and Swedana should be done. The age is also Purve Vaisi Madhyava Talprayogyam Jidatmani. That is also not possible. Control of the mind. It is not exactly control of the mind, it is relaxation of the mind. And systemic comorbidities as diabetes should be also mentioned upon. The modified protocol. In order to bypass the strict parameters of the rasayana protocol, we have modified the rasayana protocol into Murdu Snehana, Murdu Swedana, Murdu Shodhana. The selection of the drug which has the apt site of action, mind relaxation techniques like yoga, and the drug should not interfere with the comorbidities. The issues to be addressed in cancer management, we are coming back. Number one is cure, which is very difficult, but we should aim. This should be one of our aims. Then manageability, control of symptoms, and of course, improving the quality of life. The aim of cancer treatment in Ayurveda is to provide a safe, effective, economical, supportive, and alternate treatment to check cancer growth or to improve the quality of life of cancer patients. There are many objectives, of which the primary objective is to evaluate the effectiveness of Ayurvedic medicines by providing a better quality of life in cancer patients who are on classical cancer treatment. We are not denying the classical cancer, Western classical cancer treatment. We are with it also. But there are 5 secondary objectives. Number one, whether concurrent administration of Ayurvedic medicines is effective when applied in patients undergoing classical oncology therapy. Number 2, whether the effect is curative, palliative, or preventive to metastasis. Number 3, the effect of Ayurvedic medicines in various types of cancers. And number 4, in various stages of cancers. And last, whether Ayurveda can improve the 5-year survival rate of cancer patients when compared to the state and national averages. So these are our 5 important secondary objectives. One thing I would like to tell is that our treatment is to be patient-centric. I'm not against any researches. Researches should be done. But in Ayurveda, only the black box design will be suitable, I think. Because accordingly, we have to change the medicines. Suppose the patient has a cough at night, we'll be giving Bilodi Leha. No, you cannot give Bilodi Leha because the patient is under a particular regimen of management. It should not be like that. We should have the ability to change the treatment according to the condition of the patient. Nothing is rigid in Ayurveda. Everything is patient-centric than disease-centric, what I'll tell you. Then my talk is coming to an end. I am giving certain examples of case studies which you have done. Number one, this was a suspected prostate cancer because we have not got the histopathological evidence, but all the other evidences are there. He is still living. He is a 76. He was at that time a 76-year-old male. he complained of dysuria, fullness of the hypogastrium. Being an anorectal practitioner, I have done anorectal examination and found that it was quite large, sumptuously large. The investigations done were ultrasonogram primarily, then MRI, then PSA, then ESR also was taken, but not histopathological examination, for which I had my own reasons. The principal management was given by Panyachara, by Gotcharachara. For about 1 year, he has taken Panyachara. Afterwards, I suspected that something is going wrong with the blood, and I checked nothing. Everything was normal, even after 1 year of continuous use, incessant use of Panyachara. Also, other medicines were there, because medicines of Astyamayanta Ghruda and Lekhu Lokeshwara Rasa prepared in Kapardiga was also given to the patient. I don't know which medicine has worked. Anyway, it has worked. The result is that the patient is asymptomatic for 4.5 years now. The mass size has been reduced. The PSA has returned to normal. ESR was also returned to normal. I don't know whether you can read this, because it is the initial volume was 155 cc prostate, 155 cc, grossly enlarged, mildly heterogenic signals. Heterogenic signals were there. It was not homogeneous signals. Heterogeneous signals were there. Here also heterogeneous signals were there. And his blood report means ESR was 105 in the beginning of treatment. PSA was 13.4. But after the treatment, PSA has returned to 3.1 and ESR came to 21. So this is one example. But I cannot tell that this was a pure cancer case, because I have not got any histopathological evidence. But there are, of course, other cases also. This is a recent case which we have treated, pseudomyxoma peritonei. The case was of a male of 55 years. Gross ascites was there. The patient couldn't stand on his own legs. He was literally to be taken to the consultation chamber. Abdominal palpation was done, but it was not palpable. And surprisingly, I thought it was a case of Udara. But fluid thrill was also not there. I suspected why. Investigations like CT, USG, MRI, and histopathological evidence was also taken. Preparatory management was downsizing, surgical downsizing. I asked the patient to go for surgery and remove all the debris and then come back to me. And the patient was treated by Panyachara, by Pudigachara. The other medicines given to the patient were Punarnamadikvatha, Bhallatagavadi, Neem, Rasasandora, etc. The result, asymptomatic for 2 months now. The abdominal size has been significantly reduced. Anyway, I don't know whether you can read all these things. It was a case of pseudomyxoma peritonei. It was diagnosed in 2018. He underwent a debulking on 11/5/2022. This is the patient. This is the patient after treatment. Before treatment, he couldn't even stand like this. I have not exposed the face of the patient for identity's sake, but he was smiling perfectly after the treatment was over. But he is now driving his Jeep also, to my surprise. I don't know how it is made possible. Another case is of a case of adenocarcinoma of proximal ascending colon. The presentation was it was a female of 86 years. She presented with melena, weight loss, cachexia, and severe anemia. All the usual paraphernalia of USG, MRI, PET scan, and histopathological examinations were done. Principal management again, Panyachara by Palashachara for 6 months continuously. Even now, she is taking Panyachara. Also, Mahadiktaka Varanadikwatha, and a curious Kwatha by name Hriberadikwatha, Rasasindura, etc. were given. The result is that the patient is asymptomatic for 1.5 years now. We don't know what will happen to the patient next, but we rest assured that the patient is okay now for the time being. At least once upon a time, one patient asked me, Doctor, Adinu polum Adine sadhicha madi. See, that is the terminal patient's wish, the wish of a terminal patient. Here, you can see the MRI report here. Asymmetrical heterogeneous enhancing partial thickening ascending colon, suggestive of malignant growth of colon, and ascending colon growth, moderately differentiated adenocarcinoma. That is the histopathological evidence. Then this is a case of dermatofibrosarcoma protuberans. It is a large name, comparatively large name. And I hadn't come across such a case previously. And it was a young patient, young female of 31 years with lymphedema of the left leg on hanging the legs and difficulty in walking because of the lymphedema. On examination, the inguinal and abdominal palpation were done, but no palpable lump or lymph nodes were found because all these were removed. Investigations, histopathological examination, previous management by excision, and the principal management which I gave was Shiva Gudiga, Navapashanam, Neem. Neem is a principal ingredient wherever management is done. Then Punarnavadikwatha, Talakavasma, and Guglutan Kashaya. The result is asymptomatic for 11 months now. These are the case reports. It was histopathologically diagnosed as a case of dermatofibrosarcoma protuberans. It is a very rare cancer, very rare, extremely rare cancer. Then this is a case of endocrine cancer. First, when he came to me, I didn't know what was meant by endocrine cancer. Where is its origin? Where is its spread? I didn't know anything about it. So I read and understood. The presentation was severe cachexia, extreme weakness, severe body pain, B-O-N-Y, severe body pain. Patient was wincing with pain. Why? Where is the cancer? In those days, the cancer was in the ribs because there is a rib biopsy report also. But where is the primary cancer? Nobody knows. What type of cancer it is? It is endocrine cancer. They have diagnosed it like that. Investigations like ultrasonogram, MRI, and ESR was done. Even histopathological evidence is also there. The principal management which we gave was Panyakshara, Neem, and Bhallatagavadi. The result is that the patient is asymptomatic for over an year, but later succumbed. Now the patient is no more. Neuroendocrine tumors arise from the cells that release hormones. That is how it got its name. And make abnormal amounts of hormones, causing many different symptoms. In this patient, it was severe pain. All neuroendocrine tumors are not malignant. Some neuroendocrine tumors are malignant. This one was malignant. These are the case reports. Multiple means in the patient's body, most of the bones are involved. Most of the bones. And hence excruciating pain. Where from the pain comes, even the patient does not know. Patient എന്നോട് പറഞ്ഞതെന്ന് വെച്ചാൽ മൂത്രമൊഴിക്കാനൊന്ന് പോയാൽ മതിയായിരുന്നു രാത്രിയൊക്കെ. അതിനെ മറ്റുള്ളവരെ വിളിച്ചുണർത്താതിരിക്കാൻ വേണ്ടിയിട്ട് പെയിൻ ഉണ്ടായിക്കോട്ടെ എന്ന പേഷ്യന്റ് പറഞ്ഞു. It was that much severe. And another one was an ovarian cancer, which we have treated here in PNNM itself, in our college. The patient presented with gross metastasis, but without serious symptoms. No serious symptoms were there, but the patient's body was as if it is made up of neoplasia. Abdominal palpation, odd lumps all over, investigations like ultrasonogram, MRI, histopathological examination, ESR, markers, everything was done. Principal management was again Panyakshara, Neem with Artharaga paste, because it was one of the topic of our PG students to enhance the to prevent anorexia. Internally with Grada, the result is that the patient was asymptomatic for over a year. After that, we don't know what happened, frankly speaking. So many reports are there. I'm not going into individual reports. Multiple echogenic lesion with cystic areas imaged surrounding the ulcers or an ovarian mass. Features of ovarian tumor with metastatic deposits. These are the itinerary of her case reports. I'm not going into the details because our next speaker, we are all eagerly waiting for the talk of our next speaker. Interval cytoreduction was done. You should know that during this interval cytoreduction, almost her entire abdominal contents were removed. Partial colectomy was done, ovarian ovaries were removed, uterus was removed, part of the stomach was removed by Bilrut incision. Everything was done. The patient was but happy. She was not having much symptoms when she came to us. And look at the report. On 18/7/20, when she came to us, her CA 125 values. This is one of the markers. CA 125 values was 800 unit per ml. After our treatment, it has reduced to 353 unit per ml. It has not come down to normal. Agree. But it has come down miraculously. But after a period of time, again, it started to increase to 437.4 units. See, this was the improvement which we got. This is another case who is coming to our OP. This is a case of rodent ulcer, basal cell cancer, which this was referred by the Department of Salyatantra. Ulcer over the lower part of the eye and inferior aspects. The management which we have done is Panyachara itself. The result is status quo. The wound has not completely healed, but healed nicely. It has reduced and is without symptoms now. Then there's a case of very old multiple myeloma. The patient presented with severe low backache. SLR palpation, everything was done. I thought that it was an ordinary case of low backache. But later, on investigation, I knew that it was a case of multiple myeloma. And the drugs which we have given, at that time I remember that some 20 years ago, the drugs which I have given as Quatha was Jadi Patra, Neem leaves, Tulasi, Ushamalari, Paranti, Kanjanara bark, etc. No Rasashastra medicines were given at that time because I didn't know anything about Rasashastra on those days. I didn't give anything. But to my surprise, within 3-4 days, everything was normal. But the patient went to Sri Chitra, our regional cancer center, Trivandrum, and there on examination they told that you had not got any multiple myeloma because the report is okay now. You can go back like that. I treated for only 1 week with these medicines. I don't know what happened, but the patient is allergic to Ayurveda. He couldn't consume Ayurveda. And he went back to lead normal life because those people told him that everything was normal. But after 2 years, again, because of the same diagnosis, he was admitted in Amrita Hospital and he breathed his last. So this is a case of this, my last case which I am presenting here. Case of RCC, renal cell carcinoma with lung metastasis. See, renal cell carcinoma with lung metastasis is, you should go through the pictures. Everywhere it is there. In the body, lungs, abdomen, everywhere, cancer is there. Severe anorexia, exhaustion. CT was done, contrast enhanced CT was done, everything was done. The principal management was drug therapy because even histopathological examination was done, but I don't have histopathological report. Principal management was drug therapy with bhalla, simple drug therapy. Even Chara was not given. Simple bhalla takavadi, Shilajit capsule and neem tablet was given. Result, anorexia and exhaustion relieved. And within 1 or 2 weeks, that's what I'm telling. These are his case reports. If time permits, you can go through, you can have a copy of this and you can go through it. Everything is written here. Then, towards winding up my talk, a proposed combined protocol I'm giving you. Arogya Shamana drugs, Dosha Shamana drugs, Agriya Ushada means single drugs, Panyachara, then medicines for Yogavahi property, then certain herbal cytotoxic drugs, mineral cytotoxic drugs, Balavarthana group of drugs, Snehabana. Meanwhile, I'll tell you one more thing. There was a patient, Vinith's patient, was having melanoma. We managed the case with Snehabana, but during the time of management, we didn't get any relief, and he went to other treatments. And the doctors there also told that you cannot expect more. Maximum you will live for 1 month. You will not get more life. But after treatment, he is now live after 3 months of treatment. But each month of treatment's cost, he is telling that approximately comes to 5 lakhs of rupees. Each course of treatment, with which 1 month life he can extend maximum. So we have given Snehavana, Rasayana, Hita Ahara Vihara, and Sthaniya Chikitsa. The suggestions is that, my suggestions, our suggestions, PNNM suggestions is that understand the concept of the disease to its current understanding. Everything, including the etiology, prevention, diagnosis, management strategy, drugs they use, that also we should study. The cytotoxic drugs they use, how they act, the safety profile, everything we have to study and translate the understanding to our own science. That's the need of the day, and chart out our own management strategies. Cutting it short, I'll tell you that this is but putting the text into the right context with modified application of Ayurveda context. The motto is meaningful longevity. We all will die one day. There is no doubt. But we should give the patient maximum support for meaningful longevity, happy longevity, and healthy longevity. Thank you one and all for patient listening for our 1 hours now. Thank you.
Thank you, sir. That was a highly information. Thank you very much for enlightening us with your most valuable experiences, sir. On this occasion, we are proud to mention that there are upcoming PG dissertations on Ayurveda Oncology from Department of Salyatantra of PNNM Ayurveda Medical College and Hospital. Thank you, sir, for guiding us. Now we are moving on to a quick interactive session. Participants may use this opportunity to clear your doubts.
Sir, I have a doubt. I don't know whether it is a relevant doubt or not. I was just asking about the Rasayana portion. Rasayana, ultimately Rasayana is Rasadi Dhadu optimization. So Prakritika Kapha will be increased now because repairing and all those things are happening. So, and we know that the growth is also indebted to Kapha. So it is important that Lina Doshata all should be understood by a practitioner. Still, I doubt whether the injudicious use, not as per the classics, but as per the practical version of a clinician, injudicious use will lead to recurrence.
Thank you for your nice question. That is the most relevant question you have asked. Rasayana ensures premium quality of dhatus. It is not just increase in dhatus. Vidashavantha, Paisa Arthamasa, Hridayana Tailena Sukhambunava, Krishasya Pushtim Abhusha Vidatte Balasya Sesyasya Yathaso Rushti. It is not just increasing the size of the body, as if you are increasing the size of the body with steroids. It is increase of the premium quality of the tissues that is meant by Rasayana. And one more thing I will tell you about Kapha, you are speaking something. Kapha has got two roles, dual roles. One is Ojas, another is Papma. Being a Kajilsa specialist, you know that in Charaka Samhita there is a quote of the dual role of Kapha in the body. We are improving that Ojas part of Kapha, not the Papma part of Kapha. Being a Shalya practitioner, I know that the discharges, the slough and everything, that is also part of the Kapha. And the new growth that helps the body to heal up the wound, that is also caused by Kapha. Everything is masterminded by Vata. So I think that if you give proper treatment, proper medicine, and at the same time, I am once more repeating that mind also should be taken into consideration. I don't frankly believe that cancer occurs by these things alone. There's a mind factor also, which also should be taken into consideration in the management pattern also. Then only you will get proper relief. Because the same medicine is given to everybody who is suffering from, say, for example, stomach cancer. The benefits are versatile. Some patients are getting good results while some patients are not being benefited at all. Why? Because the mind is there. It plays a pivotal role, not only in cancer, but in cancer it is very important. Am I clear? Thank you.
Any other question?
Sir, my name is Dr. Abdul from Ayurveda College. Ayurveda College. Okay. My question is, we are treating mainly related with Tridoshas. So, any relation is there when we look in the treatment of cancer? Sir told that it cannot be directly related to Arbuda, what we have told in Ayurveda. We just relating the modern term, Arbuda is related with cancer. But sir related the disease to Vadashivanata mainly. And Arbuda is the word is coming in Vadashivanata Samprapti also. So my question is, can we treat according to Tridosha by avoiding Rasaushadis? Avoiding Rasaushadis in cancer management. Avoiding Rasaushadis. No, sir. Then another aspect is, mainly we are concentrating in Actimandhya. So if Actimandhya is prevalent in cancer, then we can correct Actimandhya, then can be treated with cancer or Arbuda. And also Srodha Shodhana aspects can be taken into account in treatment. This is the two questions.
So the principal questions were two. Number one, why you have to use Rasaushadhis in cancer, you are asking. Rasaushadhis are used for two important benefits. Number one, herbal drugs have not got the momentum to act site-specifically. It is not that it has not got the momentum. In some cases, I myself has projected that only Kashtaushisis were used in management. But if Rasaushadhis are also used, we will get more momentum to go into the perfect site of action. Number one. Number two, this may act as cytolytic also. Our drugs means herbal drugs might not have that ability in very complicated conditions. But even then, we are giving Kashtaushathis only. Chara is taken from Kashtaushathi only. And Chara Pana Chikitsa is related with Kashtaushathi only. But in rare instances, we have to give Rasaushadhis as well. That is about the one question. The second question is that you are asking about the Agnimandhya. Agnimandhya can directly be related to Srodharatha. Wherever Srodharatha occurs, there Roga occurs. So Agnimandhya, removal of Agnimandhya means removal of Srodharatha. Proper Agni means proper Srodhasis. So that perspective we have taken in all the treatment, whichever management we are giving, Srodharatha is taken as a thief behind the curtain. We are just witnessing it, and then we are doing the management. Okay, thank you. Any other questions, please?
So we had a lot of experience of terminal stage, managing the terminal stage of cancer in our institution itself. But unfortunately, we didn't get the initial stage of cancer. But is there any management protocol? How we have to approach the initial stage of cancer? Is there any management protocol?
All the protocols which we have designed here can be employed in newer cases also, cases of new diagnosis also. But the issue is that suppose we are not successful in our attempt, because we are only beginners in cancer therapy. Just 2-3 years we have seriously entered into the therapy of cancer. But suppose there is some other treatment available for cancer which is better than us, chemotherapy, radiation, surgery, etc., etc. Why we have to lose the privilege of the patients? Let them go for the treatment, whatever treatment is available. And if they cannot do anything, let them come to us. That's why we are telling that our cases are terminal cases. Patients who cannot go anywhere, patients who are desolate, patients who have spent their all their what do you call assets into the management, those patients are our patients. We can, of course, manage new cases also. There is no doubt that it is not that I'm not telling that we cannot manage new cases. We can manage newly, freshly diagnosed cases. But if some better management is there, why should we close the door for them to decide upon the management strategy? That's what I'm telling.
Thank you, sir. So with that, we are winding up the first session.
വളരെ നന്ദി സർ. ഓക്കെ.
I'm a house surgeon from Arya Medical College. My name is Devishri. So my question is, as you said, if there is another option for the patient in the initial cases, newly diagnosed cases, if there is other possibilities for the patient, let them go. But most of the time, chemotherapy is itself a reason. I have heard that chemotherapy is itself a reason for recurrence. Itself a reason for recurrence of cancer. I have heard, I don't know how much it's, proved by research, I don't know. But if there is a chance of recurrence, why would we just leave them? And my second question is, most of the...
Your first question is?
Does chemotherapy has a role in recurrence?
As if somebody does chemotherapy in cancer,
Sir.
there is any chance for recurrence. Okay.
And second question is, most of the patients in terminal situation have gone through so many chemotherapy that they have severe loss of appetite and they have no sense of taste. I have heard it. I'm not much experienced in these cases. So if that's the situation, most of our drugs act with the presence of appetite.
Can I ask in Malayalam also?
സർ വിശപ്പുള്ളപ്പോഴല്ല നമ്മുടെ മെഡിസിൻ കൂടുതൽ വർക്ക് ചെയ്യുക. വിശപ്പ് ഒരു ഫാക്ടറാണ്, അവിടെ വേണമല്ലോ അഗ്നി. അപ്പൊ കീമോതെറാപ്പി ഒരുപാട് ചെയ്ത് കഴിഞ്ഞ ആൾക്കാർക്ക് വിശപ്പ് ഇല്ല, അല്ലെങ്കിൽ ടേസ്റ്റിന്റെ സെൻസ് ആ രുചി, അതൊക്കെ നമ്മൾ ഭയങ്കര അനിഷ്ട ലക്ഷണം പോലെ പറയുന്ന സംഭവങ്ങളാണല്ലോ. സോ ടെർമിനൽ കേസസ് ആണ് നമ്മുടെ പേഷ്യന്റ്, അവരാണ് നമ്മുടെ മെയിൻ ഫോക്കസ് എന്ന് പറയുമ്പോൾ.
So primarily you are against chemotherapy. And you think that by doing chemotherapy, what did you tell initially? That there is a chance for recurrence. There can be, it all depends upon the type of cancer and the stage of cancer. If chemotherapy is done in the very initial stages using the perfect cocktail of drugs meant for that condition, it may not recur. But unfortunately, what happens? What we have, what is the definition of Arogya? Tattal Lakshana Samashtadaya Bodhita Abhyantara Vikriti Parampara Eva Paramartha Arogya. I think you might have gone through that definition. The disease, the pathological features of the disease, which are what do you call, which are projected through its lakshanas. That is the pathological current. That is the Arogya. But suppose the lakshanas are not there. Suppose somebody is not having any symptom. After a long period, that means after the cancer spreads all over the body only, one will come to know that there is cancer. What can be done? Nothing can be done. At that time, if you employ chemotherapy means there is no other way than to employ chemotherapy. If chemotherapy is employed, there can be a chance of recurrence. Because for that purpose, you should go through the hallmarks of cancer. About 13 hallmarks of cancer I have described here. Cancer has got that peculiar ability to cheat the body and to cheat itself also. So recurrence can be there. We are only in the initial stages. We don't know. Patients are getting relief with our medicines. Yes. Good symptomatic relief we are getting. But is our treatment radical? Practically speaking, we don't know. Because after the treatment, we are not going for a histopathological examination. After the treatment, what our aim, what our motto is to bring back the patient to normalcy, biological normalcy. And after biological normalcy is achieved, we can go for a scanning, that's all. But we cannot go for a biopsy. That is the issue. And number one. Number two, the second question you raised was? Loss of appetite. You may better ask Dr. Arya, who is our senior PG student here. Her topic was anorexia in cancer. And we have managed anorexia in cancer with NIMBA. NIMBA? Yes, NIMBA. Which is Tiktarasa. Tiktam Swayam Arojishno. Arujiknam Param. Haven't you studied in Ashtanga Hridaya? Along with Ardraga. And along with a little of Grada we have given. Fantastic results we have got. In anorexia related with cancer. So it is not that we cannot do many things. We can do many things. Even anorexia associated with cancers and associated with the management of cancers, there is medicine and Ayurveda. Okay? Thank you.
Thank you, sir, for your wonderful words and wonderful session. And it's time to honor our faculty, Dr.T.Sreekumar, sir. I invite Mrs. Sandhya Mannath, Director, PNNM Ayurveda Medical College, to honor Dr.T.Sreekumar, sir, with a memento as a token of gratitude. And I request Dr.T.Sreekumar, sir, to receive the memento. I request Madhu sir also to join them. Thank you, sir. This was a very wonderful session. You have enlightened us with your valuable words and experiences. Thank you. Thank you, sir, once again. And we have to move on to the next session. But before that, tea is served here. So we have a very short tea break. Be back in the hall within 10 minutes. Thank you. The tea is served outside the hall. We will start our next session at 11:15 sharp. Thank you.
and left. തിരിച്ചിരിക്കുക. ഓ അതെ. ചായ കുടിച്ചില്ല. ചായ കുടിച്ചു.
session. Before that, we need to introduce our distinguished faculty.
We heartily invite Dr. K.M.Madhu Varier, sir, who is presently the Chief Medical Officer of Arya Sala Charitable Hospital. Sir has passed out his degree from VPSV Ayurveda Medical College in 1995, and he has it from VPSV Ayurveda Medical College in 1995, and he has 26 years of extensive experience in care of cancer patients from all over India at our special cancer clinic OP at AVS Charitable Hospital. Is also working on database studies on relevant herbs in relevant cases. Sir also has 2 years experience in pain and palliative clinic at Calicut Medical College. And two of Sir's studies which are published are Shadadauda Grida in oral mucositis induced by radiation, and Mishrika Sneha in morphine-induced constipation. Sir, we heartily invite you for your valuable presentation.
Shall we start? Good morning, my dear students and the faculty of this college and the faculties from other Ayurveda colleges. First of all, I want to give a big thank you to Dr.Sreekumar, your principal, and Sandhya madam for giving me such an opportunity to come before you and talk some of our experience, sharing some of our experience with you. I can see so many young faces here, future of Ayurveda. So we rely on you to run this show for after us. So please, Ayurveda has a great potential. I think Dr. Sreekumar has told you very well. And the difference between the topics may be because Sir has given a very informative and very relevant topic presentation here. And he's a good academician as well as a good practitioner. Where I am only a practitioner, so my topic or my presentation style is of a typical practitioner because we are in the practical side. So I'm very much thankful to Dr. Sreekumar. I told him that we have also adopted some of his treatment strategies with our treatments like Paniya Kshara Chikrasa. It's a very effective management strategy which Sir has practiced for so many years. So I think we will start the session right now. So thank you for a good, nice introduction from the team here. So I'm very happy that you have selected the cancer for today's topic because it's a very relevant one. As Ayurvedic students, you may be wondering that what we can do with our science for treating Ayurveda. So in the next few minutes, I want to share some of our experience, which may be useful to all of you who will be entering this treatment system. So cancer relevance is of great importance. See, the cancer burden in India in 2018. Shall we off this? Cancer burden in India in 2018 is 1.16 million. So I think 7 lakhs or 84,000 odd deaths are there in cancer. So that's the relevance of this disease. Even though there are so many good treatment modalities in modern science, it lacks so many things that you can see from our presentation. So it's a 2.26 million 5 years prevalent cases. As I told you, even though the modern system has developed very much, we have certain roles in managing cancer. So that's what I want to emphasize on you regarding this. So burden per year with projection. The latest National Cancer Registry Program report has projected that the country will have 13.9 lakh cancer cases in this year and will increase to 15.7 lakhs by 2025. So there is an enormous increase which is happening in India. And as in our nation, the problem is, see, so many people are below the poverty line and they could not afford this kind of a treatment. As Dr. Sir has told that one patient's example, that he has to spend 5 lakhs to survive for 1 month. That may not be a possible one as far as we are concerned. And cancer mortality is one of the big problem which we as India we are facing. Even though the incidence of cancer is high in developed world like US, UK or Canada, the mortality in that regions remains low compared to the developing countries. Why it is? Because of the lack of awareness among our public regarding the disease. And also there is no periodical checkups in our country. That is also one of the major problems. And 80% of cancer cases detected are in advanced state in our country. That is a big problem which is happening now. So and at that time, the curative aspect may be lost because we have to stick on to the palliative management for those kind of advanced diseases. So that's a big problem which we face. See, I want to just tell you what Ayurveda Sala has done in this regard. As an institution, you might maybe be knowing about our institution. It is a 125-year-old institution, which is in a charitable trust, run by a trust in our institution. And it was started by great Vaidya P.S. Varier, who is a very visionary in Ayurveda. As this Ayurveda colleges, every Ayurveda colleges may be thankful to great P.S. Varier because for starting such a good, noble venue. And I think we have started our clinic in 1999 in our charitable hospital. It was headed by our late managing trustee, Dr. P.K. Varier. And you might be knowing Dr. K. Rajagopalan sir, who is a well-versed person in both modern medicine and Ayurveda. And these two great pillars were with us while starting the 99 in this OP. And I was fortunately one among them at that time under their guidance. And what we have intended to do with this scheme is to aim of the clinic is to provide a special service to the cancer patients with a systemic data recording, because most of the Ayurvedic hospitals has a problem for data recording. So the data, which is a very cardinal thing, because when you just go to any modern hospitals or any modern world, they will ask you about the data. What is the data? Is your data. So the data has to be there. So what we have intended to do is to start a database system. We have a system in our hospital where we record all these things, all these cancer cases, and the data is there. So with that data, we can make a studies in this regard. So that's what we want to do, because in the future generation, when you comes to Ayurveda, so that kind of a time, what we want to do is that evidence-based Ayurveda should be there before the public. So that is the aim of our clinic, and also to provide a service to the poor, needy cancer patients who are at a very lost stage. And unlike the other type of cases, when you see in the Kayachikitsa OP or Salyatantra OP, these patients are very different one, because they are seeing their death. Most of the people are seeing death. That is a problem. So there you might be knowing that their psychological problem, as Sir has rightly pointed out about the psychological care to be given to the cancer patient, because in our experience also it's a very big thing, because to just hear them is enough for them to do that. But unfortunately in our country, no hospital has such a facility, because everybody is very busy with them and may not be understanding their problems, that cancer patients' problems. And these are okay. These are some of the diagnosis-wise data which we have in our hospital from 2015 to 2020. Breast, ovary, cervix, and endometrial cancers are there. So that is the main thing which I want to tell you. And also some cancer, lung also I will describe in my topic later on. And these are some of the data which we got in this number of cases which we got in our department. And as you know, as I told you earlier, I'm not an academician, I'm only a practitioner. But in my experience, I can say that in cancer in Ayurveda, it's a very vague topic which we say. According to Dr. Rajwan sir also, it is not a one single entity in our science about the cancer, so-called cancer in the modern world. So this described on various topics like this Arbuda, Grandhi, so many other topics which is being described. And we have to take those topics, as Dr. Sir has rightly pointed out, that has to be taken out and we have to adopt it in the modern times. That's what we want to attempt. So without, the modern science, the development has to be studied well, then only we can understand what our science has told. Like doctor has told that about the cancer management and the chemotherapeutic drug also. As doctors who are working in that field, we know we are constantly studying the cancer, the chemotherapeutic drugs and its action, its side effects, everything we have to study. Then only we have to tackle the patient very well. See, these are some of our textual references regarding that. You might be knowing that, in Madhava Nidana, it is like this. Vadadayo Mamsamasrik Pradushya. So many examples are there. So that has to be taken care. But it is not merely with this only, with this example, we cannot treat the modern cancer cases. In our OP, we got 150 type of cancer diagnosis within the past few years. So that's the magnanimity of this science, because there are so many cancer patients with different type of diagnosis, especially some very rare type of cancers also comes to Ayurveda for their, hoping for their good relief. So we have to be very careful about that. And also Arbudam, you might be knowing about the Sushruta Samhitas, this Gatra Pradeshe, Kujadeva Dosha, that already you have studied, I think. Hope all of you are, the PGs or, house surgeons. Okay. And prognosis also written about the metastasis also, it is very clearly written on our science, like Birarbuda, which is very much relevant nowadays. So Birarbuda, because one has so many questions were asked about the metastasis. So the metastasis is a part in our cancer care, because so many cases with metastasis comes to us in stage 3 or 4. As we know that most of the cases coming to us are in a terminal stage. So most of them have multiple metastases like skeletal, lymph node, so many other metastases. So we have to study it very carefully, and also we have to, get into that treatment too. And general treatments are described as per dosha predominance. I think the dosha predominance can be applied in certain areas. It is okay. And internal as well as external medications are required in this as a medical management. Surgical measures, I think sir has a very good experience in surgical management. I have not have such experience, but it is part of the cancer management, surgical measures. So dosha predominance to be taken care, and also we have to study the modern topic also. Then only we have to apply our science to the patients, condition of the patients. I think that in the last sir's presentation, it is clearly written that it's a patient-centric one, not a disease-centric one. That's a very correct thing. If you are treating cancer patients in a patient-centric manner, I think you will get good results rather than going for a disease-centric approach. But when you want to have a recognition from the international community, you might have to go for a disease-specific thing. That is a main dilemma which we have in our care. So the current scenario, it is very difficult to make diagnosis and treatment only with these descriptions. Only with Ayurvedic perspective or only with Ayurvedic descriptions, it's very difficult to treat cancer patients at this juncture. Maybe I'm not the person to tell about that because the academicians has to tell. But in our clinical experience, we can say that only with Ayurvedic descriptions, we may not have to able to tackle the disease. Using modern diagnostic tools, all the modern diagnostic tools like PET, CT, CECT, everything has to be taken care, and it has to be used by us too. Then only we will get a good proper diagnosis and proper way of treatment. And dosha predominance and the experience, that also we want to say. In our experience, we can say that most of the cancer patients have a Vata and Kapha dominant condition. As sir has told, Vata's action is there, but the Kapha dominant thing is a Vata Kapha disease is there as per our experience. And you may be knowing that as per Ayurveda, Ashtanga Vigaro Namakushala, that slogam, you may be knowing that we may not have to get a disease name, but we have to treat the disease according to the doshic predominance. And treatment options. There are Shamana Chikitsa options and Shodhana Chikitsa options. In the present context, Shamana Chikitsa plays a major role rather than a Shodhana Chikitsa. I will tell you in my experience how it works. And there are 2-3 group of patients usually in a cancer care OP in Ayurveda. One is the patients completing modern treatments and coming for prevention of recurrence, because that's a great problem for most of the cancer patients. Those who have any relatives as cancer patients, they may be knowing that stress, because the patient will be in a constant stress, expecting a next recurrence. So after undergoing the modern cancer treatment, they will tell you that after chemotherapy and radiation, everything, the patient is okay, then you can go. But the patient's condition may not be like that. After 1 year or 2 years, he may or she may have the recurrence. So that's the area, one of the area where Ayurvedic methods are being treated properly. And second group is patients on modern therapies, but without satisfactory outcome. And it includes patients who could not tolerate aggressive therapies. That is also what is, in our experience, we are seeing such patients. Even though then they are doing the chemotherapy. This student has rightly pointed out about the cancer chemotherapy and the recurrence. No, see, this is what happening, because in later stages, when you go to a modern oncologist, even though they may be trying some cancer chemotherapies. What chemotherapies? It's basically a cytotoxic treatment. After doing the cytotoxic treatment, what is the net results which may happen is that the immune system may be collapsed and the disease will progress. So nothing to be done. As per modern science, they will say that this is the only option which they have. But we have the option at that time. At that time, we usually administer our drugs, and we usually tell the patients that at that point of time, it is not ideal to take chemotherapy. But it is according to the condition. We have to judge the condition properly. As sir has told, we don't have to deny any treatment to any patients, because if the chemotherapy works well, then you have to do the chemotherapy itself. But if it may not work well, then it is not point in continuing with the chemotherapy. That is one example which is happening. This lady has correctly pointed out that problem. The student has correctly pointed out that problem. It is there in our clinical practice. And third group is opting Ayurveda as a first line of management or purely on Ayurvedic medicine. Even though it's a very small number, we have such patients who are opting Ayurveda as a prime line of management after getting diagnosed from any modern hospitals, and they are straightly coming to us for their treatment for various reasons. They may be afraid of modern treatments, or maybe the economical problem may be there, or so many other issues are there. So they are straightly coming to our center. And these are the two types. 1 and 2, it's contribute 90% of patients, and group 3 is 10%. As per our experience, It is like that 10% of people who are coming to us is coming straightly to Ayurveda. 90% of patients, they may be going to modern science earlier, and after so many other things, the first and second group, as I told you earlier, that is a 90% constitute that. And 10% is so far, but 10% is a good number, no, because we can make certain things in that 10%. And the treatment modalities which we opt in our center in Kottakkal Ayurveda is, in the first group, we usually adopt the Rasayana treatments as per the Agni and other constituents, which we adopt so many Rasayana drugs to be given for a longer period, so that it can prevent the further recurrence of the condition. And the discussion on Agni is very important, because Agni and the Srodhorodham, which has told, because it's a main problem which is happening, and it is not there in the modern science, you know. It is a big tool for us to do Agni Deepana drugs to be given as a Srodho Shodhana or Srodhorodha to be avoided by giving such medications. And in second and third groups, Shamana as well as Shodhana Chikitsa can be administered. Shodhana Chikitsa as per the requirement, because when you do the Panchakarma therapies, the patient's condition is anarhas and arhas are there, you know. So we have to, as doctor has rightly pointed out, it's a patient-centric one. If the patient is fit for doing such things, you can do that. But unfortunately, the patients who are on in a later stage, like the third or fourth stage of malignancy, may not have that ability to undergo our things. So we usually give some Mridu Virejana or such things we may do. But the Panchakarmas like Vastis or other things, Vamana Virejana, that kind of things may not be possible. When I go to most of the northern states, they usually ask a question, can we do some Panchakarma in this condition? I tell them that it may not be possible to do Panchakarma at this point of time when the patient is in a very bad shape. And there are some incidents where we got from some quacks who have done these kind of as Panchakarma, the Vasti-like things, and the patient was in a very bad shape and they came to us. That is also one experience which we have. Without studying the patient properly, if you administer such things, it may end up in a very big trouble. And there are some limitations. May have limitations in administering medicines and assessing results in group 2, especially when the patient is on a chemotherapy and we are giving the medicines, and at that time that may be very difficult to administer the medicines in certain conditions. If you have a profuse vomiting, or if you have a profuse dyspnea, that sort of things, if it is there, and there may be some dysphagia may be there, that sort of things is a very limitation for Ayurvedic management. And emergency management may arise in the group 3. That is also a big problem for us, that purely on Ayurvedic medicines, if the patient has an emergency problem like severe dyspnea or severe pain or severe vomiting, that sort of things may be there. So at that point of time, there are some limitations. We may have to rely on modern system of treatment at that point of time. Fortunately, Ayurveda Shala has a modern group with us, modern hospital with us. So as a modern wing of hospital is there in our hospital itself. So we usually do such things, giving the IV drips, everything that can be taken at that point. And beneficial Rasayana drugs in our experiences, these kind of things, like Ashwagandha Churnam, Agastya Rasayanam. Agastya Rasayanam, I think it is a Rasayanam which should be given, which can be given for a very long time. Dr. Rajavan sir usually tells that people that take the Agastya Rasayana for a very long time, that is a good Rasayana Aushadha, which can be given for longer periods. And Chavanaprasham, of course, you know, Arushkaram also, that we have made a capsule for that. Siddha Magaradajam, even though it is a very costly one, but it is a good drug for as a Rasayana. And Swarnabhasma also, it is a good Rasayana. In this cancer condition, especially in the cachexic condition, the Swarnabhasma's action is very good. And also as a beneficial Rasayanas for preventing recurrence, in the first group of people, we can administer these medicines according to their Agni, according to their conditions. We can administer these medications for a longer time. This is some of the experienced drugs which we have. And we don't have to rely on one single drug. That is not a good ideal thing. There are some misconceptions about Ayurvedic management among the public that with a single drug you can use, like Tribhala, you can control the cancer, or with curcumin, you can control the cancer, or with ashwagandha. People used to say that ashwagandha, we are taking ashwagandha. See, ashwagandha is one of the drug in the Rasayana, which says there are so many other things are also there. So we don't have to rely on singly on any such medications. And the Shamana Chikitsa means oral medications mainly. These are some of the medicines which we usually use in the management. Because these medicines has to be used according to the conditions. That's what I want to say. Dimbamridadi, Panchadiktam, Kwadam, Gulguludiktam. Gulguludikta yoga is a very good condition. According to its yoga itself, it's a Arbudahara yoga and it's a Vadagabha Shamana drug. And it is a very good thing. Then Varanadi yoga, it is a good thing. Rasa Sindhuram and Rasagandhi Mediga. This Rasagandhi Mediga was very much in use from the time of Dr. Rajavan sir in our OP. He used to do that, and we have made that medicine too. And other symptomatic management, as doctor has told, it's a symptomatic management may be required in most of the cancer patients. When you are giving these kind of medicines also, you may have to incorporate so many symptomatic management, especially when you have a big cough. You have to give certain medications, or if you have a purging or wearage, that kind of loose stools, then also we have to give certain medications. So that also, it's a the physician has to decide that kind of things, because that should come from the experience. When you have a good experience in treating cancer patients, then you can easily say such things. And see, the Gulgulud, I want to share you one example. Gulguludiktam Kashayam was studied in our research department. Ayurveda Sala has a research department called Center for Medicinal Plant Research, which is funded by Tata, and it's a renowned international center there. So they have studied our Gulguludiktam Kashayam. When we used it for so many cancer patients, they have studied the Gulguludikta yoga as such, without depleting that one. And it was published in a Springer journal, and the 27 anti-cancerous compounds were identified in this drug. And we usually see that when you give the Gulguludiktam Kashayam, the good improvement is there. See, but the thing is that we may not be able to compare with the modern therapy, because when you are doing the chemotherapy or such therapies, this drug may not be comparing with that, but it's a drug which should be studied well, because one of the study was like this. And another one is the Rasa Sindhuram. Rasa Sindhuram, usually most of the Ayurvedic patients are frightened with Rasa Sindhuram and Rasagandhi Mediga. But in our OP, what we usually do is that when you give Rasa Sindhuram to any patients, first of all, we will take their renal function test, and after 3 months, every 3 months, we usually do the renal function test. And in our department, we have a data that no patients have any renal impairment while taking our Rasa Sindhuram. And we have made a study in IIT Kharagpur, Ayurveda Shala has made a study in which the renal permeability of Rasa Sindhuram is good. So that there is no such problem when you are using Rasa Sindhuram for a long time itself also you can use. But provided you have to study the patient's profile well. I want to express with you, because so many Ayurvedic physicians ask us about the Rasa Sindhura and Rasaushadis. Rasaushadis are very dangerous as per them. But it is a fact that Rasaushadis, if you are using it properly, Sarah has used Talagabasma, etc. That kind of uses, it's a very beneficial in cancer management. When you do only with the herbal drugs, you may not get much speed of action in the management of cancer patients, especially the terminally ill cancer patients. The time is very precious. We have to give them medicines properly, because their days are numbered. When you just into that OP, you can see so many faces looking us with number of days in their lives. So that at that point of time, we may have to do the treatment according to very proper things, and the experience also comes. So that is the one thing. When you use Rasaushadis properly, there is no problem. But the problem is that when the Rasaushadis are not prepared properly, that is a problem which happens. when I went to a couple of years back, I have a meeting in Mumbai where I just found that one of the chemistry professors from University of Pune has studied our Rasasinduram very well, and he has made a good chemical profile about that, and it is a very nice thing, which it doesn't have such toxicities, but it has good actions too. And also the Rasasinduram has an action of a catalyst too. In our experience, when you give the Rasasinduram along with other medication, it may act as a catalyst. It's not a proven thing, but in our experience, we can say such things. And Shodhana Chikitsa, usually administer Shodhana Chikitsa in managing side effects of aggressive therapies. We get so many patients of having big side effects of chemotherapies, as well as, you can see that a big neuropathic problems. Neuropathy is one of the commonest side effects where the patient suffers for a long time. And also there may be some frequent urination, that our Apana Vaigunya, which says that sort of things are there in the side effect of chemotherapies. And it can be administered, the Shodhana Chikitsa can be administered, also can be performed as per a physical condition of the patient. As I told you, when you are admitting such a patient, it should be properly cared about their physical condition, whether they are suitable for these kind of things. Especially some patients, we usually do only Sweda and Sneha Karmas. So that also may give them a good relief for these kind of neuropathies. And in some patients, we used to have every Virejana and Vastis, etc., which can be done in that, because that also counts. And gastric issues, also a big problem for that. That can be given with the oral medication itself. And there are some potential areas I want to express with you, especially to the students. I want to express with you the two areas where modern medications have certain limitations, but we have so many options with us. One is a geriatric oncology, where you can see that in our country itself, the geriatric population is on increase, and the geriatric population, the incidence of cancer is also increasing. So at that point of time, what happens is that the geriatric patients, especially, they may not be in a position to undergo modern therapies due to various reasons. Especially their health condition may not permit for that, and they may not have such ability to do such things. So at that point of time, doing Ayurvedic therapies, we have so many experience I can share with you. And the palliative care, of course, I have worked with the palliative care in medical college. I have some experience with that. And the palliative care, I think in Kerala, the government of Kerala has made palliative care as a policy of them, and the Ayurveda is included in that, and we usually give certain inputs for that too. And geriatric oncology is a branch of medicine that is connected with the diagnosis treatment of cancer in the elderly, usually defined as age 65 and older. So it's a very common condition which we get in our OP. So many patients coming to us are in this group. And patients who are not fit for conventional therapies or advanced disease condition. Suppose a patient having hepatocellular carcinoma with multiple metastasis, or having ascites like things, and they may not have any condition. At that point of time, the student's question is very relevant, because when you do the chemotherapy, at that point of time, the result will be negative. I have seen so many cases with that negative results. They have tried the chemotherapy and the patient's condition were very much diminished or they deteriorated after the chemotherapy, and they were in a very bad state. And after that, the modern doctors will say that we don't have anything to do right now. So the patient will be in a very dilemma. So at that point of time, if you administer Ayurvedic therapies well, then the quality of life of the patient as well as the longevity can be improved to a good extent. I think that is a good thing. The 5-year survival rate is a big condition in cancer management or cancer survival system. As international level also, we can say that it's a good thing. And I can just I want to share some of my other experience too. See, I have a experience in Delhi when I was a participant at that time. It was a Indo-American joint venture for managing with traditional systems. So when Indian government had a word with American government, we have proposed certain things like arthritis and such things. But right away, the US government asked that in cancer management, can you do anything? Because they have good options for that. So we have a good interaction with the US oncologists at that point, at that meeting, where good interactions were done. And they were much impressed with our system of treatment, like this longevity, increasing the longevity as well as the quality of life. That itself is a good thing, because the modern medicine may not have that kind of an ability to do such things. So it is our strength. But unfortunately, the problem is that we don't have enough data. That is a problem. So when they ask us regarding the quality of life data, like the ECOG scale, that so many scales are there. So we don't have such things. That's a problem. But we are trying to make such things to make such good, in the international way. We want to project our science. And these are some of the examples. You can see that a 72-year-old CA rectum case with conventional treatments, though conventional treatments were done, and the 3-year duration still survives. That patient was still surviving. And the CA colon, you can see that surgery was done, but he was reluctant to do such modern chemotherapies at that time, and could avoid aggressive therapies. That's a big thing which you can say, that if a person with 72 years can avoid aggressive therapies like chemo, then that itself is a good thing for, and his quality of life will improve. Even though death is an inevitable thing, but we can have a good quality of life at this time. But you can just make a comparison while doing the chemotherapy in an older age and while doing the Ayurvedic therapies. If you just see the quality of life will be much more good with the Ayurvedic therapies. In our experience, it is like that. But we have to make data for that. And there's an interesting case of 80-year-old person with CA prostate. He has survived 6 years without any modern interventions and died recently. So that's a good thing, no? You can see that. And so this is a very interesting case of chondrosarcoma with lung metastasis. I have explained it in so many venues that this is a case which still survives. This not 6 years, it's a 10-year survival is there. Now also he has recently detected with skin malignancy, which the radiation is going on now. This patient is at Calicut, and he still recently had a rare metastasis in skin and underwent RT. So these are some of the rarest cases which we get, and the patient still lives. No, that's the thing. Because as in the earlier session also says about the patient-centric thing. This is a patient-centric thing because the patient is living without much problems. So that itself is a good thing. And now this is a definition of palliative care according to the WHO. We know that mainly the physical, psychological well-being of the patient. That is the main thing, and we know that we have a good definition that samadosha samagnischa samadadu malakriya prasannatmendriya mana swasthaitya vidiyade. The same thing modern people has described in this way. So Ayurveda is basically we are giving a good quality of life, and in this it's a relevant increased number of incurable cancer patients are there. Now the problem I have in my earlier stage, I have told you that 80% of cancer patients detected in India is in an advanced stage. So they may be put into a palliative care. But the problem in India is that only 1% of needy persons in India gets the palliative care. So the 99 patients or 90% of patients who requires palliative care is not being provided in our country. That is a problem with us. But in Kerala, it's different. No, Kerala, the palliative care network is very, very good, and it is not at all comparable with any other states in India. So this is the thing. This is the data from the government of India. And there is a social awareness among our, especially in Kerala public, the social awareness is there to go for a palliative care therapy. That's a good care is there. And these are some of the earlier studies which that introducer has rightly pointed out, the Misraga Sneham study, Shadadaudam, Vishwamridam study in managing anorexia. These are 3 studies which we have done in medical college itself, in palliative care department of Calicut Medical College. And one of the things, this Pishraka Sneham was published in an international journal. It was published, and the rest two studies may not be published because the the number of patients or the sample size was not such a big way. So, but the effect was good. And this is also one of the areas where I can say you, say triple negative malignant cancers. This cancer breast, if you are treating the cancer breast, triple negative cancers occurs in about 10 to 20% of diagnosed cancer, breast cancer patients. In this triple negative cancer patients, there is a big chance of recurrence as per the modern science itself. So, it will not react to the hormonal therapies. So that's the main problem which is facing by the modern medicine. So when you treat such triple negative cancer patients, so I can see you that this is a data which is a sample of data which we have. 9 cases I have just seen here. So triple negative cases with 10-year to 3-year survivals. So there is a good survival with Ayurvedic medicines when the patients take our medicines properly for a longer period. See, the problem what happens is that when the triple negative cancer breast cases, if the patient may not have such symptoms, they may have a tendency to stop our medications. So that's a problem. So they have to take it for a long time. At least we usually ask them to take 1 or 2 years of continuous medication with continuous surveillance by us, because that is also much important. So this is one of the thing which we have noticed, and the pain and lymphedema, which is a very big problem in cancer breast cases, and that is also can be managed with the Ayurvedic medications. So that's a good thing. So these are some of the areas where Ayurveda can perform well. But we know that our system has so many lacunae that we know very well. But the thing is that there are some strengths with us. And these are some of the single drugs which we are using in, according to our experience, the Tippalis we are using mostly in the leukemia cases, because it's a Srotorodhara drug as well as the Prihamaye Pippali as a that kind of a treaty is that. So that also we usually apply here. And Karanja Patra extract we usually use in prostatic malignancy, which has a tendency to reduce the prostatic antigen values by giving it with other medications, especially with that sort of medication. If you give this medication along with them, so there is a tendency to reduce PSA values. And Arushkaram, it's a tumor reducing, it's a Tishna drug, it's a tumor reducing drug. And Sahadevi, which this is the Veronia cinerea, it's botanical name Sahadevi, which is a drug which we are using in our OP for most of the cases. Those who are experienced in our OP in Kottakkal, they may have heard about this Sahadevi, because this Sahadevi is a good drug which is being happening. And this drug also we want to study a lot, because if you study a good, having a good drug study, I think there are so many, like the Gulguludikta Kashayam, these also may have such a good anti-cancerous properties. And the leaves of Puvarishra, that is, these were all given by Dr. Rajavan sir in our OP. And we maintain the blood counts. Usually in the leukemias, there are chance of a fluctuation in blood counts when the disease is not on control. So at that point of time, we usually administer the Paniyam from Puvarishra leaves. But it's a part of the treatment. And this is also the one which I have told you, 80 years of male with the prostate CA, and survived for 6 years, done orchidectomy, advised chemotherapy, but took our medication. So he could avoid such things. And these were the medicines which we were given. Most of the time these medicines were given. And the Dashamulam Paniyam, it is also a Vatahara drug, and it's also good for most of the well-being of the patient. It is a good thing. And we usually use this kind of a prescription. And this is a case where I have earlier described you. It's a very interesting case which we have. The 10-year survival at this age, at this group. That is a good thing. He also have similar type of medications. And later on, for the past 2-3 years, we have adopted Sir's treatment like Paniyakshara Chikitsa also we have adopted along with this. And we are also getting good improvement with that, the Kshara medication. See, this is a CS lung case. CA lung, you know that the survival rate is very bad as per the modern science. Even the 5-year survival with CA lung is very rarest thing. And these were some of the cases where this is a 58-year-old male with a poorly differentiated adenocarcinoma, and he has visited here on 17 and 22. Now this is a 5-year survival without any recurrence. He has undergone the chemotherapy and radiation, but the recurrence was prevented with these kind of things because they may have a chance of a recurrence. So survived 5 years without a recurrence, and he is living well. Only some small problems are there, but it is okay. And this is 66-year-old male with moderately differentiated squamous cell carcinoma, and that also survived 5 years without any recurrence. See, this may be a single case or may not be a good size, but it's a good pointer thing for entering into this area. That's what I want to tell you. And this is also survived 4 years without any recurrence. This lady with the poorly differentiated adenocarcinoma stage 2A. And next slide is very important for us. It's a case which survived only with Ayurveda. They have not done any modern therapies. There are 2 examples I want to just quote with you. One is a person with a 63-year-old male bronchogenic carcinoma with mediastinal and abdominal lymphadenopathy. This was a stage 3 case at that time of the diagnosis itself. And he could survive 3 years without much issues. So that is one area. Even though 3-year survival is not a big thing, because the 5-year survival rate is a thing which we have to achieve, but we have achieved this kind of things. And this is an 80-year-old male with bronchogenic carcinoma with non-small cell type, stage 2B. And this also survived 2 years. He has expired. These 2 patients were expired. And the second person, this 80-year-old person, expired due to cardiac arrest itself. There was no much problem with the cancer because there was initially he had a big dyspnea and cough, etc. But it was not there. See, in this condition, what we have experienced is in bronchogenic carcinoma, the action of Ela Kanadi Kashayam and Balajiragadi Kashayam. If you can give these medications, I think it's a symptomatic one also, and also it is giving good relief to the patients. Along with that, we usually give the Rasasinduram, Sahadevi, etc., that kind of medications, and also some Rasayana Aushadas also will be given to these patients. So these are some of the examples which we have. What I want to stress you is that Ayurveda has some role to play in the cancer management. Even though we have certain limitations, I think if we work all together, we may have a good, success in this field. That is possible. That in our experience, it is like that. We may not compare with the modern system because the thing is that the modern system, they have a research world over. It's international research is being done in the modern science. But unfortunately, we don't have such facilities. With our limited facilities, we can do such things. That's our experience, which I want to share with you. And now a collaborative research program is being planned now with MER Cancer Center in Calicut. This was happened when these kind of cancer lung cases we have presented before MER Cancer Center Oncologist Board, and they were very much impressed, and they came to our hospital and they took all our case sheets and they have studied, and they know that there is something in Ayurveda to deal with cancer lung cases. So they have planned, and we have planned to do such things in as a joint venture with the MER Cancer Center. Regarding the drug study as well as clinical study, we are planning, and we are getting an aid from Department of Ayush in Government of India for that. And now the study is being, we will start it very shortly. We will start the study. See, these are all some of the experience which we have, and this is a good chances are there for improving our system in the current era. Now, I want to conclude my session, and there is a possible area of intervention with yoga, even though I'm not an expert in yoga, but stress management during the treatment. As Sir has told that, the stress which is happening in these cases, when a patient is diagnosed with malignancy, And if you ask them about that particular incident, they may say that it's a very big stress which they may be undergoing. So that kind of things, if we can manage with yoga and maintaining well-being after the treatment, that is also one important thing. And post-treatment stress management, that is also a big problem. Post-treatment, there are so many stresses, especially in ladies, there are so many stress factors there. And also stress management during terminal stage. During terminal stage, management in the home itself is a big problem. And that also the yoga can play a good role. We are planning certain yoga related things with the VPSV Ayurveda College Kottakkal. There is a good yoga unit is there. You might be knowing that. And we are planning something because it's not materialized now. But I think there is a chance for such yoga intervention along with our treatment. As a conclusion, I can say that Ayurveda has a role in oncology because we were not think about such a role for Ayurveda in the oncology. Initially, we thought that our system can work in certain areas, but it's not like that. There is a role. And yoga can be incorporated with Ayurvedic treatment. Multidisciplinary approach will be an ideal choice. That's why we have a mutual interaction with the Pain and Palliative Clinic in Medical College and MVR Cancer Center. And recently with Amrita Hospital also we made certain discussions regarding that. And fortunately the Amrita Hospital, some of the cases they are referring to us. So that is also what is happening now. And needs for further studies for identifying enormous potential of Ayurveda. In the drug study as well as the clinical study, it requires such a identifying methods with Ayurvedic potentials because we are not using the full potential of our science. We use certain medications and we do certain practices, that's all. But as an institution, I think the PNM can do such things because there is a good potential for that. If we work together for these kind of things, I think the beneficiary will the public as well as our science, Ayurveda. Because if we can contribute certain things to Ayurveda itself, I think that will be much more good. So now I once again thanking Dr. Sreekumar sir, Sandhya madam, other management persons of PNM Ayurveda College, and for a patient hearing for all the students here. Thank you very much.
Thank you, sir, for this enlightening session. The thoughts you shared are highly helpful to improve our views on Ayurveda oncology. Sir has also pointed out the significance of recording the collected data in support of evidence-based medicine. Thank you, sir. Dr.K.M.Madhu Varier സാറിന് PNNM കുടുംബത്തിന്റെ സ്നേഹോപഹാരം സമർപ്പിക്കുന്നതിന് Sorry. So we are moving on to the interactive session. Participants may raise your doubts.
I think for your doubts, I may not be able to answer like Dr. Sreekumar sir because he's a very experienced person. I am a practitioner. In my experience with the practice, I can explain to you. So please ask questions.
Hi, myself Dr. Sreekumar.
Okay.
So I have a question on stomach cancer. A person who is having a stomach cancer has taken chemotherapy and it is completely cured, for example, and he's in a good lifestyle from 1 year, and he comes to a Ayurveda physician and with anxiety of whether he will get a reoccurrence of the disease. What kind of a treatment line we can follow? And also, as he is eligible for Panchakarma treatment, because he is healthy enough now, can he undergo any Panchakarma treatment, and which will be the best Panchakarma treatment for him?
Can I ask you certain questions? What is the stage of that disease? Is it the primary stage or any other metastasis, distant metastasis is there for that?
It's in a primary stage.
Primary stage. Yeah. And the PET, CT, etc. has been done, and there is no such malignancy has been detected so far. Is it so? After the chemotherapy? I think you can have a good Panchakarma treatment here, and to make the to improve the Agni Bala, as well as to give good Rasayana Aushadas, because Rasayana Aushadas can play in such good role in that condition. I think if you use such medications for a long time, it will be good.
But what panchakarma will be better for him, whether basti or?
See, that depends on his condition, whether he has any problems right now or only this anxiety. Any other issues are there?
No, he's a healthy person, like, just to avoid the reoccurrence of the disease. Like, as it follow a treatment line, what are the medications we can follow? And a panchakarma treated, what we can do?
See, panchakarma treatments, every shodhana treatment may not be necessary in that condition. Or you can use the virejana, simple virejana, it is possible. And also, if it is necessary, you can have the vasti too. They're like yoga vasti, that sort of things can be done. And in our experience, giving rasayana aushadas for a longer period may be useful in that. And the stress management is also important. Like some tarpana, that sort of, this tailadhara, etc. That sort of treatment also can be taken care in that condition. Because the main problem is the stress regarding that recurrence, is it so? So the recurrent stress, first of all, we may have to educate the patient regarding the recurrence. What is his problem and what is the recurrence? Everything we have to educate him. And you can also give, this rasayana aushadas for a longer period. Indugandham yoga, it's a very good yoga which can be given for a longer period. Indugandham kashayam or Indugandha gridham. Gridha yogam can be given for a longer period. That will be much more useful in that condition. And panchakarmas according to his conditions, that we have to see the patient and we have to judge his condition, then we can do that. If he is a healthy person, you can undergo all the procedures.
Thank you.
Okay, welcome. Okay.
Sorry, I am the same person asking question.
Yeah, okay.
So, Madhu sir, I know Madhu sir early itself, we met before also. We both studied in the same college for UG, in Kottakkal Ayurveda College. This is not the question. Okay. My question is, can we try holistic approach in treatment of when in case coming to you, doctor? After allopathic treatment, you just withdraw the allopathic treatment and try Ayurvedic treatment only, or continuing allopathic treatment along with with support for getting the better quality of the life of that patient, you are giving Ayurvedic treatment. First question is that. And also, I know Kottakkal Arya Sala is a holistic hospital, charitable hospital, and you get the support of allopathic system also. The second question is, sir rightly present the Agnimadhi aspect and Srodha Shodhana aspect and the bad effects of chemotherapy that we are getting because of the allopathic system of medicine treatment. And my question is, can sir share your challenges when you treat, because of a lot of experience with treatment of malignancies? Can you share some of the challenges you faced in some of the cases, not revealing the patient's name or the conditions? And with that condition, can you reveal share some of the challenges you faced when treating the malignancy of treatment? It will be very beneficial for all Ayurvedic lovers all over the world.
Okay, thank you for the question. And regarding the holistic approach, it is possible, but the thing is that holistic approach, when you just having a interaction with the modern people, you have to understand their conditions and their systems. And also we may have to educate them regarding our system, what we are doing in this, what is a way of action regarding that. And it is possible to give Ayurvedic medicines along with the modern system too, because there may be an add-on effect for giving Ayurvedic medicine. There are so many examples like that. When you just when somebody is undergoing the chemotherapies, if you are giving certain drugs, especially some rasayana aushadis or some drugs like the Indugandha yoga, that kind of things, the quality of life or the tolerance level of the chemotherapy can be improved at that point of time. That is number one. Regarding that, the condition of the patient has to be studied. We cannot broadly say that we can give these kind of things because each patient is different. When you are treating a patient undergoing modern therapies and along with our treatment, and the condition is important, stage 3 or stage 4, or even it's a primary malignancy. That sort of things we have to be taken care. It is possible to do such things. And regarding the experience, some problems which we faced is that, usually the profuse vomiting is one of the problem which we are facing, especially the CA stomach, or and in some patients, I can say one good example, this common problem of dysphagia, that is lack of problem for degglutination or getting food. So there was one person came from Malappuram. There is a rich person who has a CA in esophagus with multiple metastasis, and he was put on IV daily from this home itself. And that patient has only one hope, that he want to take one meal. That's the only thing which he want to do, because he's 75 years old. That person told me that I will die, that I know, but before dying I want to take one meal. That's only one hope, only one thing which he has to do. So we have tried, and what we have tried at that time is Varanadi Grida Yoga along with the Kalyanakshara. That was given, and also the Gomudra, Gavyam. It's a very Tishna Aushadhis, and Lekana properties also there. So we have given that patient Gomudra in a divided dose, and also this Varanadi Kodam with the Kalyanakshara. That is the thing which we have given at that time. Fortunately, what happened is that after 2 weeks of application of these medicines, the patient could be able to take some liquid food, like from fruit juices, some liquids he may have to take. And after 1 month, the patient died. And before that, he took one meal. And that, his son has called me, and he came to my office, and he has given me a shake hand and told that the father has taken one meal. That's what has happened. That is, that we can do, but we have to study the case properly and do that. That's one experience which we have. And another experience is that one gentleman who was, we know him very well, that patient was having a CS stomach with multiple metastasis. And he was taken medications, and after that, he was put on palliative care. Palliative care, they were admitted in the Calicut Palliative Care Hospital there in Calicut. And one evening, the son of that patient has called me and told me that my father will die after 1 hour, as per the doctor. What can I do? Sir, can you just save him? So I was in a dilemma. How can we say such things? No, because the patient is unconscious at that time, and he is on a nasal feed. And the concerned doctor in the palliative department has a word with me. She told me that in our science, we don't have anything to do, and he will die. You can do anything you like. So as a thing, what I have done is that I have given that patient the Gaurochanadi Gulika 2 tablets in hourly manner in warm water. Only hourly manner. Even though the patient may die, then we can try that. No. So fortunately, after giving it hourly, 2 tablets in every hour, after 3 hours, the patient woken up, because he has this conscious level was improved, and that patient was survived for next 2 weeks, and after that he died. So that is also one of the experience which I got. That it may not be a single one, but at that point of time, can you just imagine the mindset of that son or that family, where his father or that person is in a dying phase? And if we can do that, if we can extend his life for at least for next 1 hour or 2 hours, that is a good satisfaction for the family members. So that is the way which the sir has told, that the patient-centric thing, we can do such things, but we have to take our yukti. Yukti is very important for as far as Ayurvedic physicians are concerned. Even the modern science, if they are going for a protocols, free protocols, they have a protocols for everything. Without protocol, they won't do anything. So that is a big problem for modern medicine too, because they don't have to use their logic for that. But fortunately, Ayurveda physicians can use our logic with the help of our science. If you use the logic properly, with proper braveness, then I think you can do so many things. All of you can do such things. It is possible with our medications to do such things. But we should be courageous enough And we should study properly the case as well as the patient has to be studied properly. Then it is possible to do those things. I think these are some of the few examples which I can quote before you. Thank you.
Sir,
Yeah.
myself Aparna from KC department. I am a final year PG scholar.
Oh.
Okay. Sir, my first question is, in which Kalpana you have administered that Sahadevi?
See, there is no such theoretical or textual reference for Sahadevi. It is a thing which we have in our experience. We have made such things. That there is no textual reference for Sahadevi, because it's from our experience. We have taken that plan and we have given that. That's all.
Is it in Swarasa or Kalpana?
No, it's in Swarasa also we can give, but as far as a patient is concerned, we are giving as a hydroalcoholic extract, and also some patients we are giving it's a Lehya form, because Swarasa and things it may be very difficult for the patient to take, and they have to identify the plant and take the Swarasa, etc. So we are, as a prepared drug, we are giving that to the patient.
Sir, can we utilize Guruji Sattva in cancer patients? Have you any experience?
See, we have not used Guruji Sattva in our experience, but I think there may be chances. I think we have to try that. Then only we can say. I don't have that experience.
Sir, in your experience, can you trace out the etiological factors, like factors resulting in Vidakta Jirna or Vishtabda Jirna, like that? Resulting in Vidakta Jirna or Vishtabda Jirna, like that?
See, it is very difficult to point out such things. I have told you I am not an academician. It is very difficult to point out such things in a practical way. I think you have to study it accordingly. In your college, you can study that. I don't have the answer for that. To be frank, I don't have the answer for that.
Sir, I have asked this question because most of the physicians are correlating the cancerous conditions related with Vadarakta. So in Vadarakta, the underlying pathology is Ushna Vidahitva. So the Ajirna behind that is nothing but the Vidakta Ajirna. And that may be the reason for the action of the Rasa Ushadis in correcting that Ushna Vidaha. So Rasa is Shidam. Prasada Bhavam can be brought about by the implementation of usage like Rasasindura. That's why I have asked the question.
That your hypothesis on this is maybe correct, because we don't know exactly it is like that. And we have not studied according to that sort of things. It's a purely an Ayurvedic way of management which you are asking. So we have not studied in such a way. But we can't say that whether it is correct or not.
Okay, sir. Thank you.
Welcome.
Hello, sir.
Hello.
I would like to ask, can you narrate your experiences of treating any cases of triple negative breast cancers?
Yeah, I have already told you that triple negative breast cancer patients, usually they come up with after undergoing the modern therapies like surgery or chemotherapy or radiation. And after that, the survival rate with the triple negative cancer cases is good. That I have told you in that slide. I think it is possible to prevent the further recurrence in especially the skeletal recurrence, which may be happening in the triple negative cancer cases. So if you can give the medication for a longer time, I think it is possible to do such things.
Hello, sir.
Hello.
While doing this group 2, as you said, the Shodhana therapy after this chemo therapy, is it for the reducing this chemo-induced toxicity? If so, will it affect the cytotoxic effect of the chemotherapy drugs?
No, it won't. In our experience, it is not affecting the cytotoxic effect of the desired cytotoxic effect of the chemotherapy. But usually the ill effect of chemotherapy, which can be managed. I think the Srodhorodha can be reduced as per this Shodhana karmas. I think that is the way which it may be working.
What all Shodhana therapy can be done?
See, the simple virechana we can do in certain conditions. Mridu virechana we can do, and also vasti if it is possible. If the patient's condition is good, then we can do vastis which are suitable in that condition. Two things are there, but vamana, according to me, may not be a suitable one in malignant case. According to me, that's the only thing I can tell you.
So is it after the proper snehapana?
See, smaller dose of sneha can be given, but the proper snehapana cannot be administered at this point of time. So what we are giving is a smaller dose of sneha can be given, and then a mridu swedana. Then after that we can give such things.
Okay, thank you, sir. Yeah. So one more question. This Sahadeviya, the Lehyam you have mentioned, what's that proper formulation?
See, formation is this Sahadevi and this Gomutra is there, and Karuga, Gomutra and Sahadevi. These are the three ingredients in that Sahadevi. And then we are making a Lehya with that. But the problem with that Lehya is it's not a palatable one. That's a problem. So what we are using is we are making a capsule out of that, and that capsule also we are giving. But when you want a Lekhana property, I think the Sahadeviya, the Lehyam is the most important thing, because the Lekhana property can be given from that Gomutra's action. I think at that point of time we have to give that, and also you can make some anumanas like honey, etc. can be added with that and give it to that.
Thanks.
Yeah.
Sir.
Hi.
Years back in a seminar, I have heard from Honorable P.K. Varier, sir, that in a case of Baddaguda due to CA, he had given Gomutra Vasti.
Yeah.
And we were eager to hear where you are going to mention Gomutra, because earlier I have asked Sreekumar sir also in the previous session about the importance of Gomutra. In the Sahadevi here we can, it is undergoing Paga, so it is hygienic and all. But apart from that, in the raw form, in what all situations you had given Gomutra?
See, Gomutra can be given only on this Kaphadikya conditions, or those conditions which requires a Lekhana karma. But if you give Gomutra in some Vrana conditions like CF, ulcerative lesions of CF stomach, it's a counter irritation may be there and the condition will worsen. So Gomutra may not be given at that time. Also which are having a Pitta dominant condition. So at that point of time, giving Gomutra may not be a good option. And for Lekhana purpose, the Gomutra is good. And you have mentioned about that case. It's a single case which Dr. Varier has mentioned. That was a case which it was happened at that time. And this Gomutra, usage of Gomutra, it is only what we can assume is that the Lekhana property is Gomutra, and it's a Tikshna Dravya too. That is also helping in maintaining such things. I think that is the way. But Gomutra cannot be given in Pitta dominant conditions. If you give that, according to our experience, if you give at that time, the patient will have a big problem and the condition may deteriorate. So we are giving it in a selective manner. And there was a study from I think it is from one of the leading hospitals in Bombay, which they have studied that the Gomutra, there was a question about Gomutra, because the bacteria in the Gomutra, if it is taken internally, may have some difficulties in human beings. But according to them, what they have mentioned is that I think the BARC has made such things. One of the lady which studied that says that bovine bacteria may not act on human cells, may not be there, because we are not having any such problems, any such cellulitis or any such toxic problem with the Gomutra. I think I have not seen any such things. So Gomutra can be given by filtering it and you can use it. But the problem is the acceptance, because most of the patients may not accept that. There is a problem. But those patients who requires that, And if they are in a very helpless situation, they will do that.
So, sir, it is
Yeah.
given directly without any adding any.
Yeah, it is given very directly. Directly you can give. Also, you can make some, some perfumes or something can be done. In our R&D, we usually do such things. When you give such things, patient may not be very difficult to take that. So if they can take it very well, then it's okay. We are giving Gomutra.
Hello, sir. I'm PG Scholar from Salyatantra department.
Oh.
My question is, as you said, in group 1 type, in patients who have done gastrectomy and pancreatic resection and all, what are the considerations or what all do we care while giving Ayurvedic internal medication? As the
Gastrectomy as well as
pancreatic resection. Because already digestion and absorption is hampered. No? So what are the considerations that we have to
first of all, the medicines which we are giving, if the medicines we are giving, if it reduces the Agni, that is a problem. And the Tikshna Shodhanas may not be done at that time. If you give some Tikshna Shodhanas, patient may find difficulties. So that also may not be given. And also, in my opinion, in that surgical condition, that the smaller dose of medications can be started initially, and then later on you can increase the dose. And along with that, you can give certain Amapasana drugs. Also, Agnidipana drugs can also be given according to their conditions. I think that is a cautions which you should take. Don't do such Tikshna Virajanas or Vamanas. That sort of things may not be done.
So, and the acne gradually will. Have you seen such cases?
Yeah, of course. It may be possible.
Okay, sir. Thank you, sir.
So, what will be the treatment approach towards leukemia?
Leukemia is a very different approach. See, leukemias are very different. Leukemias are there. So, like myeloid leukemias is the chronic lymphocytic leukemia is that chronic lymphocytic leukemia as well as chronic granulocytic leukemias are something which can be managed with Ayurvedic medications with things. What we are using is the medications we are using is one is the Indugandha Yoga, then some Ditya Kalyani. This Vincristine is the modern thing. That is also in extract form we are using that. Then Talaga Basma, Rasasindura, and Rajata Basma. Rajata Basma is also good for using that, but the dosage has to be corrected. The dosage which you can give, that is the way which we are managing the leukemia. But leukemia is very difficult to manage. In certain conditions, it may not be possible, but usually it is possible. And the Tippali Churnam also. Tippali Churnam is also good for that. It's a combination which we are giving, Nitya Kalyani, Tippali Churnam, then this Rasasinduram, Rajata Basma and Talaga Basma in a capsule form. This sort of a medication which we are giving. And also the Jarahara treatment also can be administered along with that, like Pajana Amrutangashayam, Indugandhangashayam, Amrudotaram. That depends on the conditions which we can give. Yeah.
Sir, ഇപ്പോൾ കോവിഡ് ഒരുപാട് പ്രിവെയിലന്റ് ആയിരുന്ന ഒരു ടൈമായിരുന്നു കഴിഞ്ഞത്. അപ്പോൾ ആ സമയത്ത് ഏറ്റവും കൂടുതലും റിസ്കിലുണ്ടായിരുന്നത് ഡയബറ്റിക് ആയിട്ടുള്ള പേഷ്യൻസ് ഒക്കെ റിസ്കിലായിരുന്നു. പക്ഷേ പോസ്റ്റ് ഇപ്പോൾ ക്യാൻസർ പേഷ്യൻസും ക്യാൻസർ റീസെന്റ് ക്യൂർ ആയ പേഷ്യൻസും കോവിഡ് മാത്രമല്ല എന്ത് ഇൻഫെക്ഷൻസ് ആണെങ്കിലും അവർ ഒരുപാട് റിസ്കിലുള്ളവരാണ്, ഈവൻ ഡെത്തിന്. അപ്പോൾ അങ്ങനത്തെ പേഷ്യന്റിൽ സർ ട്രീറ്റ്മെന്റ് ചെയ്തിട്ടുണ്ടെങ്കിൽ
അതൊരു നല്ല ചോദ്യമാണ് കേട്ടോ. കാരണം അത് ഈ പലപ്പോഴും നമ്മളെ പല പേഷ്യൻസും പ്രോബ്ലംസ് വന്നിട്ടുണ്ട്. ഈ കോവിഡ് എഫക്റ്റഡ് ആയി കഴിഞ്ഞാൽ ലോങ് ടേം പ്രോബ്ലംസ്, എസ്പെഷ്യലി സി എ ലങ് പേഷ്യൻസ് പലർക്കും ഈ കോവിഡ് എഫക്റ്റഡ് ആയിരിക്കും അവസാനം ന്യൂമോണിയയിലും വലിയ പ്രോബ്ലംസ് വന്ന് ഈവൻ ICUലൊക്കെ പോയിട്ടുള്ള കണ്ടീഷൻസ് ഉണ്ട്. ആ കണ്ടീഷനിൽ നമ്മൾ പല കണ്ടീഷൻ ഇപ്പോൾ ICU മാനേജ്മെന്റ് ഓഫ് കോഴ്സ് നമുക്കൊന്നും ചെയ്യാനില്ല, അത് ഓക്കെ. ബട്ട് ഈ ഇങ്ങനെയുള്ള ചാൻസസ് ഉള്ള കേസുകളിൽ നമ്മൾ എന്താ ചെയ്യാറ് വെച്ചാൽ, ഒന്ന് ഈ സിദ്ധമകരജം ഇഫ് ദേ ക്യാൻ അഫോർഡ്, അപ്പോൾ അത് വെച്ചിട്ട് ഇത് നമുക്ക് റെഗുലർ ആയിട്ട് ഒരു 3 മാസമെങ്കിലും അടുപ്പിച്ച് സിദ്ധമകരജം കൊടുക്കുന്ന ഏറ്റവും നല്ല രസായനമാണല്ലോ സ്വർണം. അപ്പൊ അതുകൊണ്ട് സ്വർണ്ണഭസ്മം അല്ലെങ്കിൽ സിദ്ധമകരജം ഇഫ് ദെയർ കണ്ടീഷൻ ഇസ് പെർമിറ്റ്സ് അതൊരു ലോങ് ടേം ഒരു 3 months കണ്ടിന്യൂസ് ആയിട്ട് കൊടുക്കുന്നത് നമുക്ക് പലപ്പോഴും ഇങ്ങനെയുള്ള ഇൻഫെക്ഷൻസ് റെക്കറന്റ് ഇൻഫെക്ഷൻസ് പ്രിവെന്റ് ചെയ്യാൻ വളരെ സഹായകരമാണ്. പിന്നെ അവരോട് ബാക്കിയുള്ള പ്രിക്കോഷൻസ് എടുക്കാൻ അവരോട് പറയാറുണ്ട്. പല പേഷ്യൻസും നമുക്ക് ഈ എസ്പെഷ്യലി നമ്മുടെ ട്രീറ്റ്മെന്റ് എടുക്കുന്ന പേഷ്യൻസിൽ വരുന്ന ഒരു പ്രശ്നമാണ് ഈ ചോദിച്ച ചോദ്യം. ഈ കോവിഡ് വരുമ്പോഴുള്ള ഇഷ്യൂ, അതായത് മറ്റുള്ള ഇഷ്യൂസ്, ഈവൻ സ്മോൾ ഇൻഫെക്ഷൻസ്, ബ്രോങ്കൈറ്റിസ്, അങ്ങനെ ചെറിയ ഇൻഫെക്ഷൻസ് അടക്കം വല്ലാതെ ഫ്ലെയർ അപ്പ് ചെയ്തിട്ട് പേഷ്യന്റ് ജനറൽ കണ്ടീഷൻ വളരെ വീക്കാവും.
അപ്പൊ നമ്മൾ കുറച്ചും കൂടി അഗ്രമായിട്ടുള്ള രസായന ഔഷധങ്ങൾ കൊടുത്തുകൊണ്ടിരിക്കുക. അത് റെഗുലറായി കൊടുക്കണം, കുറച്ചു കാലം കൊടുക്കേണ്ടി വരും. അങ്ങനെ കൊടുത്തു കഴിഞ്ഞാൽ അത് കുറഞ്ഞ് അങ്ങനെ പ്രോബ്ലംസ് വരാതെ ഇരിക്കുന്നത് കാണാറുണ്ട്. പക്ഷെ വൺസ് ഒരു ICU മാനേജ്മെന്റ് ഒക്കെ വേണ്ട കേസാണ് നമുക്കൊന്നും ചെയ്യാൻ പറ്റില്ല. ഒരു അക്യൂട്ട് റെസ്പിറേറ്ററി ഡിസ്ട്രെസ്സോ അതൊക്കെ വരുന്ന കേസുകളാണെങ്കിൽ നമുക്ക് പെട്ടെന്നൊന്നും ചെയ്യാൻ പറ്റില്ല. അതല്ലെങ്കിലൊക്കെ നമുക്ക് ചെയ്യാം. CA റെക്ടം ഒന്നാമത് നമുക്ക് അങ്ങനെ ഡയറക്റ്റായി കേസ് വരാൻ ഭയങ്കര പാടാണ്. കാരണം CA റെക്ടം അധിക കേസുകളും ഈ പോസ്റ്റ് റിസെക്ഷൻ ഒക്കെയാണ് വരാറ്. ആന്റി റിസെക്ഷൻ ഒക്കെ ചെയ്തതിന് ശേഷം വരിക. വളരെ റെയർ ആയിട്ട് നമുക്ക് അങ്ങനെ കണ്ടിട്ടുള്ളൂ. പിന്നെ ആ കണ്ടീഷനിൽ പലപ്പോഴും വസ്തി ചെയ്യാൻ പാടാവും. കാരണം ഏനൽ ബ്ലീഡിംഗ് ഒക്കെ ഉണ്ടെങ്കിൽ അത് വലിയ പ്രശ്നം ഉണ്ടാക്കാം. അപ്പൊ നമ്മൾ അങ്ങനെ ഒരു തീക്ഷ്ണമായിട്ടുള്ള വസ്തി പ്രയോഗമൊന്നും അവിടെ ചെയ്ത് നോക്കാറില്ല. പിന്നെ വേണമെങ്കിൽ അഡ്മിറ്റ് ചെയ്തിട്ടുള്ള അങ്ങനെയുള്ള പേഷ്യൻസിന് നമുക്ക് ട്രൈ ചെയ്ത് നോക്കാന്നല്ലാതെ, പക്ഷെ നമ്മളത് സാധാരണ ചെയ്യാറില്ല, വസ്തി അങ്ങനെ ചെയ്ത് നോക്കാറില്ല. പക്ഷെ ഡോക്ടർ PK വാര്യർ 1-2 കേസുകളിലൊക്കെ അങ്ങനെ ചെയ്ത് നോക്കിയിട്ടുണ്ട്. ചില കണ്ടീഷനിലൊക്കെ നന്നാവും, പക്ഷെ എല്ലാ കണ്ടീഷനിലും അത് അത്ര എഫക്റ്റീവ്. നമുക്ക് ആ കണ്ടീഷൻ ജഡ്ജ് ചെയ്യണം. കാരണം അവരെ പ്രൊഫ്യൂസ് ബ്ലീഡിങ് വന്നാൽ പിന്നെ നമുക്ക് ഒന്നും ചെയ്യാൻ പറ്റില്ല. അതൊരു വലിയ പ്രശ്നമാണ്. അപ്പൊ അതുകൊണ്ട് അത് ശ്രദ്ധിക്കണം അങ്ങനെ വസ്തിക്ക് ചെയ്യുമ്പോൾ.
So I have a question on the diet.
Okay.
So when we don't have a patient-centric treatment, that is right. I mean, we should have a patient-centric treatment in cancer.
Yeah.
But when it comes to a diet, usually, as per my experience, it's alkaline or acidic. We go for alkaline diet. So as a general protocol, can you have a diet for a cancer patient which you give in a clinic? You know?
We usually advise the patients to take the Satmya Ahara. As per their various state of patients who are coming from various states are coming to us. So what we usually do is that we will judge their diet first. Then in that diet, most of the acidic part that we can avoid, and those which are producing the amavastha, that also may be avoided. That we have to have an interaction with the patient, and we can taper or tailor the diet according to each patient. It is possible. Generally, we can say that those diet which may not produce amavastha can may be avoided, and you can give simple diet. That is the way which we advise the patients. But the nutrition may not be nutrition should be there. So that is, it should not compromise the nutrition. Yeah.
Thank you.
Okay, welcome. പീഡിയാട്രിക് മാലിഗ്നൻസീസ് അല്ലേ? പീഡിയാട്രിക് മാലിഗ്നൻസീസ് നമുക്ക് പേഷ്യൻസ് കുറവാണ്. അതങ്ങനെ അത്ര അധികം വരാറില്ല. കാരണം നമ്മുടെ ആളുകൾ എപ്പോഴും നമ്മളൊരു ട്രെൻഡ് എന്താ, സ്വതവേ ഒരു മാലിഗ്നൻസി ഡെവലപ്പ് ചെയ്യും ഉടനെ നമ്മൾ ഒരു മോഡേൺ ഹോസ്പിറ്റലിലേക്കാണ് അധികം പേരും പോവുക. പീഡിയാട്രിക് മാലിഗ്നൻസി ചെയ്തിട്ടുള്ള നല്ലൊരു കേസ് നമ്മുടെ അടുത്തുണ്ട്. അത് ഒരു ALL കേസായിരുന്നു, അക്യൂട്ട് ലിംഫോബ്ലാസ്റ്റിക് ലുക്കീമിയ വിത്ത് ഹാർട്ട് ഡിസീസ്. അങ്ങനെ ഒരു പേഷ്യന്റ് നമ്മുടെ അടുത്ത് ഉണ്ടായിരുന്നു. ആ കുട്ടി നമ്മുടെ അടുത്ത് വരുമ്പോൾ നല്ല സ്പ്ലിനോമെഗലി ഹെപ്പറ്റോമെഗലി ഒക്കെ ആയിട്ടാണ് ആ കുട്ടി വന്നത്. ഒരു 8 മാസം പ്രായമുള്ളപ്പോഴാണ് ആ കുട്ടിയെ കൊണ്ടുവന്നത്. അപ്പൊ പ്രോബ്ലം എന്താ വെച്ചാൽ കീമോതെറാപ്പി ചെയ്യാൻ വയ്യ. കാരണം ഈ ഹാർട്ട് ഡിസീസ് ഒക്കെ സെപ്റ്റൽ ഡിഫക്റ്റ് ഉണ്ട് ആ കുട്ടിക്ക്. അപ്പൊ അതുകൊണ്ട് നമ്മളെ മെഡിസിൻസ് കൊടുത്തിട്ട് ആ കുട്ടി ഒരു 10 വയസ്സ് വരെ നമ്മുടെ സർവൈലൻസിൽ ഉണ്ടായിരുന്നു. വലിയ കുഴപ്പമില്ലാണ്ട് ആ കുട്ടി വളരെ നന്നായിട്ട് ആ കുട്ടിയുടെ നമ്മൾ ഈ തിപ്പലി യോഗ ഒക്കെ കൊടുത്തു നോക്കി. അപ്പൊ അത് കൊടുത്തപ്പോൾ നമ്മളെ ഈ സ്പ്ലീനൽ എൻലാർജ്മെന്റ് ഒക്കെ നല്ലോണം കുറഞ്ഞു. ആ കുട്ടി വളരെ നോർമൽ സ്റ്റേറ്റിലെത്തി. ബട്ട് ഓൺലി തിങ് ആ കുട്ടിയുടെ ഗ്രോത്ത് കുറച്ച് റിട്ടാർഡഡ് ആയിരുന്നു. ഗ്രോത്ത് അത്ര പെർഫെക്റ്റ് ഗ്രോത്ത് എന്ന് പറയാൻ വയ്യ, പക്ഷെ ഇന്റലിജൻസ് ഒക്കെ ആ കുട്ടിക്ക് നല്ലോണം നല്ല ഇന്റലിജൻസ് ഉണ്ടായിരുന്നു. 10 വയസ്സ് വരെ നമ്മൾ കൃത്യമായിട്ട് അത് ഫോളോ അപ്പ് ചെയ്തു. അങ്ങനെ ഒരു എക്സ്പീരിയൻസ് നമുക്ക് അതിലുണ്ട്. പക്ഷെ പീഡിയാട്രിക് മാലിഗ്നൻസി ട്രീറ്റ് ചെയ്യാൻ വലിയ ബുദ്ധിമുട്ടുള്ള കാര്യങ്ങളാണ്. നമുക്ക് കിട്ടുന്ന കൂടുതൽ ഈ റെറ്റിനോബ്ലാസ്റ്റോമ, റാബ്ഡോമയോസാർക്കോമ അതൊക്കെ വരാറുണ്ട്. പക്ഷെ നമുക്ക് വലിയ പാടാണ്. ഒന്നാമത് ഡ്രഗ് അഡ്മിനിസ്റ്റർ ചെയ്യാനുള്ള ബുദ്ധിമുട്ട്, പിന്നെ പേഷ്യന്റ് പെട്ടെന്ന് ഒരു കലാപ്സിലേക്കൊക്കെ പോകാനുള്ള സാധ്യതയുണ്ട്. അപ്പൊ നമ്മൾ അവരോട് കൂടുതൽ പേഷ്യന്റിനെ പേരൻസിനെ നമ്മൾ കൺവിൻസ് ചെയ്തിട്ട് നമ്മൾ ട്രീറ്റ് ചെയ്യാറുണ്ട് ചില പേഷ്യൻസ്. പക്ഷെ നമ്പർ ഓഫ് പേഷ്യൻസ് കുറവാണ്. പൊതുവെ നമ്മുടെ സ്റ്റാറ്റിസ്റ്റിക്സിൽ ഒരു മിഡിൽ ഏജ്ഡ് പേഷ്യൻസ് ആണ് നമുക്ക് കൂടുതൽ വരുന്നത്.
Thank you, sir. Thank you for your wonderful session.
Welcome.
I'm very sure that you have sowed so many seedlings in all of our minds, and അതുകൊണ്ട് നമുക്ക് we are also running short of time, so we should wind up this session for the time being. ഇത്രയും നല്ല ഒരു സെഷൻ നമുക്ക് പകർന്നു തന്ന Dr. K.M.Madhu Varier സാറിന് PNNM കുടുംബത്തിന്റെ ഒരു സ്നേഹോപഹാരം സമർപ്പിക്കുന്നതിനായി ബഹുമാനപ്പെട്ട പ്രിൻസിപ്പൽ Dr.T.Sreekumar സാറിനെയും ഈ മെമന്റോ ഏറ്റുവാങ്ങുവാനായി Dr.K.M.Madhu സാറിനെയും സാദരം ക്ഷണിച്ചുകൊള്ളുന്നു. ഡോക്ടർ ജിജി മാത്യു സാറിനെ കൂടി വേദിയിലേക്ക് ക്ഷണിക്കുന്നു.
Thank you all. Now the scientific session is over. We are moving on to the vote of thanks. We invite Dr. Vinitha Ma'am, Associate Professor, Department of Kaya Chikitsa, PNNM Ayurveda Medical College and Hospital, for the vote of thanks.
Respected dignitaries, dear delegates, and members of PNNM family. We are now standing at terminal point of our today's session, the satellite seminar, the vote of thanks session. I am extremely privileged to stand in one of the platform of the trailer of WAC, that is World Ayurveda Congress, the satellite seminar series in PNNM Ayurveda College. This day will not have happened without a tremendous backwork. I sincerely extend my respect to all of them who worked behind it. Today's session started with a welcome speech, which was perfectly done by our Vice Principal, respected Gigi Matthew sir. Thank you, sir, for the session. The session was inaugurated by our dear patron, Muralidharan sir. His blessings are the forelight of all our achievements. Mrs. Sandhya, she is the omnipresent hand of PNNM. She had given an excellent introduction to World Ayurveda Congress. We are extremely proud that she is the Kerala coordinator of World Ayurveda Congress. Thank you. Congratulations, madam. And after that, Dr. Meera, our own faculty, had given an introduction to, not an introduction, a bird's eye view on the World Ayurveda Congress. Thank you, Dr. Meera. Though official, I sincerely extend all these persons our love and gratitude on behalf of World Ayurveda Congress and PNNM personally. Next was our scientific session. Words will be just less to talk about the two expert faculties over here. They definitely improved our vision on oncology in Ayurveda. First session was handled by our respected Sreekumar sir. He is the HOD of Salyatantra department and principal of our institution. He is the HOD of Salyatantra department and principal of our institution. He is a kind teacher and a passionate practitioner who always inspired us with his hard work and fruitful works. Sir, we are indebted to you for a selfless rendering of your thoughts. Thank you, sir, once again on behalf of PNNM and World Ayurveda Congress. Second session was handled by Madhu Varier, sir. He is the chief physician of Charitable Hospital, Arya, Sala, Kottakkal. All Ayurveda community is happy to hear that a systematic evidence-based approach to cancer treatment is being carried out in your institution since 1999. And you had shared selflessly the experience of 2 decades of treatment in your institution. Thank you, sir. Also, we are happy that Ayurveda Sala and PNNM were blessed with the shadow of Rajagopal, sir. Now I extend our sincere gratitude to the delegates. Without them, the seminar will not be a success. And our delegates were extremely keen to know more about the things, so they were actively participating in the interactive session. Thank you one and all for coming over here. Now I take this opportunity to thank our own team.
Dr. Arjun and Dr. Nimisha to manage the MC, Dr. Suraj Subhash and Dr. Manu for being our technical support, Dr. Jisha and Dr. Saraswati for supporting us, all the teaching and non-teaching staff of PNNM, all the PGs and UGs of PNNM, and above all, the God Almighty who made this session a successful one. Once again, we extend our sincere gratitude to one and all, those named and not named, on behalf of World Ayurveda Congress and PNNM Ayurveda Medical College. Thank you.
Thank you, ma'am. So with that, we are winding up today's satellite seminar conducted in connection with World Ayurveda Congress and International Arogya Expo 2022. Greetings to all our PNNM family members and the invited guest speakers and participants for making this event a grand success. So bring the principles into practice, utilize the opportunities of Ayurveda in various stages of cancer management. Thank you one and all.
ഡെലിഗേറ്റ്സിനുള്ള സർട്ടിഫിക്കറ്റ്സ് പുറത്ത് അറേഞ്ച് ചെയ്തിട്ടുണ്ട്. എല്ലാവരും അത് കളക്ട് ചെയ്തിട്ടുണ്ട്. ഈ നമ്മുടെ കോളേജിലല്ല,